So my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I have been doing this for 27 years, 28 years in September. I'm the longest serving IC support group leader in the United States, and very close to being the longest serving IC support group leader in the world. I think I'm the longest serving one that holds meetings. There are others that run organizations, but I've been working with patients for 27 years. I bring to you 3 college degrees, a degree in chemistry, a degree in biochemistry, pharmacology, drug development, a very rare degree that leads to somebody who can create new medications. I decided to not continue that career because I love animals and the animal research was killing my soul. I refused to do that. So I went back and I have a master's degree in psychology in the IC network. IC.org was my doctoral dissertation on how to bring support to patients who were homebound. Ironically, I was homebound at the time and couldn't get to school to finish it. But I'm very happy to say that my doctoral dissertation proposal has been rated #1 in the world by Harvard Medical School and the University of London. And we've been doing this for 25 years and counting. I'm very proud that in I think it was in the Harvard Medical Study, the IC network was rated at the same level that the National Cancer Institute was raised at, which is quite an honor. We have been the only IC website given that level of honors. I also sat on the U.S. Army IC research panel for about 10 years. It's the 10-year period, so I haven't done it for the last year or two. But what that did is my job on that panel was to represent you to the IC researchers. Because IC researchers, man, love the science. We're all geeks, right? I mean, a lot of us are geeks. I'm a geek. I think the bladder is fascinating. I never thought I would have a career talking about the bladder. It's very odd. But anyway, it's a really fascinating structure in the human body. The only structure in the human body designed to hold toxic waste. Have you ever asked yourself, how can the bladder hold ammonia for hours at a time? It's really fascinating that it has great defenses, that your bladder really is like your mouth. It is a hollow organ covered with a nice thick coating of mucus. And the purpose of that mucus is to protect your bladder urothelial cells from the irritants in your urine. So, and it's also the only structure that expands and contracts. And how that happens at the at the cellular level is really, really fascinating. So, anyway, I do these meetings about once a week at this point in time. I want to do more. We should be streaming on Twitch right now, but it's been a long, hard curve to try to find the time to be able to do this for you. I love running support group meetings. The way I do these meetings is I usually do 30 minutes of a lecture, and then I do 2 hours or so of taking questions from you, and then usually some sort of giveaway. Um, I have something I really, really, really want to talk about. Before I do that, I really want to talk about Veronica's question. Are there any new medications in the pipeline for IC? And again, as I said, it depends upon your subtype. I think the most interesting research study and a treatment study that was released this year was one that talked about chondroitin. And this is interesting. It's kind of like it's like the battle of the sexes, or in this case, it's the battle of the research companies. In Europe and Canada have a lot more therapies for IC bladder wall driven than the United States because we have a really rigorous FDA approval process. And we, as a nation, put safety normally as our #1 priority, but we also don't want people to waste their money doing therapies that don't show effectiveness. So there were 2 things available in Canada and Europe 20 years ago that were never made available in the United States. One was liquid chondroitin that was used as a bladder installation called Uracyst. And Uracyst had enough success in studies, a minor to moderate success, that it was approved in Canada and Europe as a bladder installation because we know the bladder wall is actually composed to chondroitin-like or GAG molecules. And then we also have hyaluronic acid or or sodium hyaluronate, also known as cystostat. And cystostat also was approved in Canada. We had patients in the United States who would send their doctors would send a prescription to Canada, and they would get one of them, one or both of them, and do them as installations here. And so over a period of about 10 years, the companies were competing with their research money. And so the chondroitin company was like, ours is the best. And they would produce a research study proving that theirs was the best. And then the hyaluronic acid company would say, no, ours is the best. Right. And this went on for a year. This went on for a decade or longer. And then finally, somebody combined the two and did chondroitin and hyaluronate together, and that's known as Ialuril. That treatment is called Ialuril, and Ialuril together, chondroitin and hyaluronate together, is much more successful. But the question is why? Why would that be successful? And that's where we had this research study that was presented in Europe, and it shows that chondroitin helps repair the integrity of the urothelial cells, that of all of the ingredients that you can find in quote unquote a natural approach, it's the chondroitin that's the most important ingredient. And then the hyaluronate is the second most important ingredient, and that's more of a coating. Whereas the chondroitin was, I'm trying to remember the language that they used in that study. When they tested the integrity of the cells, the chondroitin, um, they didn't say healing, it was like improve the structural integrity of the cell. So as you are pondering supplements, if you are somebody who wants to do supplements for IC, you most important ingredient you wanna look at is chondroitin, and that's what I've been saying to patients now that we've got this new research study that's come. Um, So, and again, there are several other things that are currently in the works, but they're not close enough. They're really not, we're getting there. But again, it all depends on subtypes. I don't want, we normally don't want you to be spending a lot of money on a bladder wall reparative therapy when your dominant problem is pudendal neuralgia. Whereas we don't want you to be doing um, physical therapy as your only therapy if your problem is Hunner's lesions. So, we're getting better at creating an intuitive pathway based upon your unique presentation of IC, and really ultimately it begins with your subtype and or your phenotype. Now, the International Painful Bladder Foundation is kind of my peer over in Europe, and they just released their newsletter, and they do a really, really good job of summarizing the recent research studies. They have a little bit more time. I used to do that. We used to have a really big research library on our website, but there's just so many studies now. It's just really impossible for me to do that again. But as I was reading it this morning, what I was really happy to see is a lot more discussion on subtype. That basically now every IC researcher in the world is willing to agree that there are at least two variations of IC patients. One variation is Hunner's lesion, and the other variation are people without Hunner's lesions. Now, of course, we know that there's diversity in this other group, but it's really good to see major researchers now in research journals admitting that there are subtypes. 20 years ago, 30 years ago, listen, if you had frequency urgency, everybody said you had an incurable bladder disease. And a lot of people said, it was an emotional mental condition, which of course we know is absolutely not true. We have $100 million of federal money alone that has clearly proven that IC is not mental or emotional. And really, ultimately, and just last week, somebody else called me whose doctor told them that it was all in their head. And my answer always back to them is, okay, if it were all in my head, why would I have a wound on my bladder? Would you please explain how the wound on my bladder got there, right? And so back then, everybody was kind of condemned to bladder therapies. And what I knew as a support group leader early on is that Elmeron, which was approved in 1996, didn't work for probably 70% of the patients who tried it. DMSO, same thing, 30 to 40% effectiveness I mean, it helped 30 to 40% of the patients out there. And we also know that IC research studies were remarkably unsuccessful. And the question is why? Why were studies not showing better results when the science of the study made sense? And of course, now we have the answer to that. The answer to that is we have subtypes. And you can't put an elephant, a giraffe, and a butterfly and a human in the same research study. And that's a really extreme example. But if you're going to put Hunter's lesion patients, pelvic floor patients, pudendal neuralgia patients, estrogen atrophy patients all in the same study, you can damn well bet that the study probably isn't going to be that successful, right? And so now we're getting to the point where at least we understand that Hunter's lesions patients really should not be in research studies that are focusing on other variants. And I think now that we're getting better at patient selection, we're going to see much better research results. If that makes a little sense. I'm a little tongue-tied today. Sorry about that. And got to open up my LaCroix sparkling water. Hey man, it's getting close to be summer. It's about 80, 90 degrees out here in California. I hope y'all are doing well today. I hope it's been a good day so far. I'm not feeling as stressed as I was. I was really stressed the first month of the stay at home, and a deep worry and things like that. And so much of that is starting to be relieved now. And I hope that that's the same for you. I really, truly hope that you're starting to feel a little bit more normal. And yes, we're going to continue to do our distancing, our social distancing, because we still have active virus, especially in the Midwest now. But there is hope on the horizon. Okay, things are getting a little bit better. So before I take your questions, I want to talk about something that happened in our last support group meeting. Um, this is a huge pet peeve of mine, and that is broad strokes. If there is one thing I have learned as an IC support group leader is that we cannot make blanket statements about IC. We cannot say everybody is this, or everybody is that, or everybody should do this, or everybody should do that. Why? When you meet other IC patients, the diversity is remarkable. It is an undeniable fact that IC is a bit of a grab bag diagnosis now, that if you got frequency, urgency, pressure, pain, and they don't find an obvious cause, they're going to tell you that you have IC. And that's really an uninformed doctor who doesn't know how to do a proper diagnostic workup. Now we know to go one step past that. Now we know that there are many conditions that can give you frequency, urgency, pressure, pain, and they're not all even from the bladder. If you have tight urethral diaphragm muscles, you're going to have frequency, urgency. If you've got fibroid tumors pushing on your bladder, guess what? You're probably going to have some pain and pressure. If you've got black mold in your house, you could have urinary frequency from that black mold contamination. And the joy of being a support group leader right now is that we are able to point patients in much more sophisticated, informed treatment algorithms, because we know how to do a diagnostic workup better. We now know that there's a huge list of confusable conditions that have to be ruled out. And so, um, at any given time in any support group meeting, let's say you got 12 people in the support group meeting, 9 out of the 12 are probably completely different. Some of you, your IC began when you were kids. For others, your IC began when you were 65 years old. You're both diagnosed with IC. Are you the same? Hell no, you're not the same. A lot of you developed IC when you fell on your tailbone. I'm seeing that like almost every day now, tailbone injury. While for others, IC began after chemotherapy. Are you the same? Hell no, you're not. You're absolutely not the same. Some of you may have a viral infection. Epstein-Barr. Did you know you can have a viral infection in your bladder? We now know that. We now know that. And in fact, researchers in Europe are the ones who have been consistently able to find viruses in the urine of patients with Hunner's lesions, which helps us understand why Hunner's lesions are so freaking hard to deal with and to manage because they're potentially viral in some of you. While others of you in more recent research studies have fungal infections. When you think bladder infection, one of my challenges here is that whenever you've got the symptoms of frequency, urgency, pressure, pain, you call your doctor, "Hey doc, I got a bladder infection and I need an antibiotic." And your doctor, if it were 10 years ago, would have said, "Sure, give you a prescription, give you sulfa, give you Bactrim over the phone, go pick it up, you're fine, take Bactrim for 10 days." Now we know that infection in the bladder can be fungal. And in fact, when the Center for Disease Control released their list of the top 10 antibiotic resistant infections threatening lives around the world, 9 were bacteria, 1 was a fungus, Candida. There are many candida infections now that are drug resistant that can become systemic if you were in the hospital and you acquire a nosocomial infection from a hospital setting. A nosocomial infection means that you've acquired it while you're at the hospital, that you were infected at the hospital or during a medical procedure. So we now know drug resistant candida infections are real. And we just had another research study which showed, and again, this is from the National Institutes of Health, the multidisciplinary approach to the study of pelvic pain research team, which is the top research team in the world. They've been working at this for more than a decade now. They're the ones who continue to make the fungal connection. So we knew 5 years ago that many patients flaring had fungal infections, candida infections. And of course, what's the problem here is that a typical urinalysis doesn't test for candida. It doesn't test for fungus. So here you've got all the symptoms of infection. You're in terrible pain. You call the doctor, you leave a urine sample. The urine sample comes back negative because the urine sample is just a simple urinalysis that tests for baseline bacteria, and you've got a raging fungal infection. And that is why next generation urine testing is so incredibly important now, because it is your way and your doctor's way of doing a fungal screen. And in fact, the most fascinating research study was the one that found that the more fungal species you have in your urine, the more severe your pain. How'd that for weird? So we're getting so much better at figuring it out. You are an anatomical mystery to be solved, my friends. And you are not all the same. There's tremendous diversity in this patient population. So, again, at our last meeting, we had at the very end of the meeting, we had a group of people come in who started telling everybody, you've got a chronic bacterial infection in your bladder wall. And that's so unfortunate. It's so unfortunate that and I saw in one of the, Facebook groups this week where they were just saying, "Hey, you all have chronic bacterial infections, and you should all be on antibiotics, and you would be cured." Well, that's reckless and harmful to say that to somebody. because it shows just flat out, the people who are saying that have never been in an IC support group, and they are not talking with the diversity of the IC patient population. Do I think some of you have chronic bacterial infections? Absolutely, I do. I think a lot more of you have chronic fungal infections because you've been taking antibiotics too much. And so as much as this very vocal group likes to continue to say that IC is a chronic bacterial infection or a fastidious bacterial infection, the research simply isn't supporting it. And I am fact driven here. I, you know, when you spend time talking with people who are they're on their last dollar and they're choosing between buying medicine and buying food, the last thing you want them to do is to invest their money in something that's unproven. It would be and as a support group leader, my greatest fear is to turn somebody off of the one treatment that could help them. Okay. And so I am completely open to the concept of chronic bacterial infection. My senior project was the isolation of drug resistant bacteria when I was in college. I get it. I understand. What I absolutely disagree with are broad statements. Because think about the patient who gets IC after chemotherapy or during chemo. Think about the person who has IC because they've got estrogen atrophy, they're IC subtype 2 bladder wall driven. Think about the patient who, when they sit down, they have a vibration, they have a fasciculation of a nerve or a muscle twitch, which is clearly pelvic floor driven. Think about the guy who um, was sliding in his socks at the top of a stairway, his legs flat underneath him. He landed right on his tailbone, went downstairs, bam, 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 like 8 stairs right on his tailbone. Had 8 tailbone injuries, literally in that 5 or 6 seconds that it took for him to fall. His symptoms started immediately after that. He did not have a chronic bacterial infection. And I think when you look at patient success stories, so one of the patient success stories I shared in our fall magazine, I think it was our fall magazine last year, was a woman who was attending one of these support group meetings, and I really try to pound in to you guys that you are a unique anatomical mystery to be solved. And I went over the 5 fundamental subtypes that we work with, which is Hunner's lesions, bladder wall driven, pelvic floor driven, nerve driven, and central sensitization, which are our core 5 variants or subtypes for IC. Now, she had had IC symptoms for basically a decade. She'd done every bladder therapy for a decade, right? And nothing worked. But her symptoms were always kind of, down by her tailbone and down by her urethra, kind of lower in the body. And so she was talking with a nurse practitioner about it, and I actually am thinking of 2 really, really good stories. Okay, so with the first woman, her pain was primarily urethral, and I will tell you right now that bladder wall driven does not normally cause urethral symptoms unless you have estrogen atrophy or an acute infection. But we don't normally see urethral symptoms in a typical IC flare, right? So here you've got a patient for 10 years. Every bladder therapy's failed. She keeps saying, it hurts here, it hurts here, it hurts right here at my urethra. That's where it is. It hurts. Help me understand why my urethra hurts. They did a CAT scan. She had a fistula. So your urethra is like the size of your little finger, right? For a woman. She had a pocket equally the size of her urethra adjacent to it with a little tube connecting them. And urine was going into the fistula. And that was creating all sorts of problems with that. Once they did the surgical repair of the fistula, she was cured. She was cured. That patient did not have a chronic bacterial infection. She had a fistula that was repairable and she was cured. We had another patient who, again, all these bladder symptoms, and in this patient's case, she was terrified of testing. She didn't want anybody to look in her bladder, and she waited years before she allowed a doctor to look in her bladder. So imagine what they found, a bladder stone. So she's laying on her back. They've numbed her urethra. They stick a cystoscope in there, take a look around. What do they see? A giant floating stone, a kidney stone that is so big it cannot pass through the urethra. And the thing about stones that's so vicious is that they're sharp, they're crystals, and they're coated with bacteria too. So here she had this sharp crystal cutting her bladder wall wherever it touched her bladder. And it had been in there for years. And we realized in hindsight, it started when she was traveling and not drinking water. She got very dehydrated. And that's something we continue to see too, which is very, very interesting. That's an interesting trend. So again, in her case, not a chronic bacterial infection. She had a bladder stone. They broke up the bladder stone. She's fine. She's fine. Now let's go over another case. Um, Another woman, although I have the same story from men too, and I was just working with a man with this, ironically, a couple of days ago. But let me tell you the story of a woman. Again, anatomical mystery to be solved. She attended one of these meetings, and again, bladder therapies hadn't worked for years and years and years. And she was very fascinated by the concept of pudendal neuralgia. So pudendal neuralgia means that the pudendal nerve is inflamed or irritated in some way or compressed in some way, usually by tight muscles. And it has its own unique set of symptoms. Somebody with pudendal neuralgia, you're very position driven. You might be fine when you stand, but when you sit down, it hurts, or when you bend over, it hurts. You get sciatica-like symptoms. You can have PGAD, persistent genital arousal disorder, where you feel aroused. It's a painful arousal sensation. Um, and ultimately, in the end, for patients with pudendal neuralgia, sitting's really hard. So she's going over these symptoms and she goes, I think I got pudendal neuralgia. So she goes back to her urologist and brings her some information she collected from our website and others and said, hey, this is me. I think I have pudendal neuralgia. I don't think it's my bladder wall at all. And the urologist takes a step back and says, well, you know what? You really don't respond to bladder therapies at all. So we've got to be fairly open-minded and look at all other things. And yeah, you really do have all the symptoms of pudendal neuralgia. I think you've got pudendal neuralgia. So then they send her to physical therapy because pudendal neuralgia is often caused by super, super tight muscles. And the physical therapist gets in there and goes, yeah, man, you have really, really tight muscles. But the physical therapy was painful. It was unusually painful. Whenever they touched around her tailbone, it hurt badly. And normally with physical therapy, what we see is that we see muscles respond fairly quickly. And so we don't expect to see pain over and over and over in this one location unless there's a physical, structural, anatomical problem in that location, right? So then she goes to another doctor and says, all right, we're trying to figure out what the hell is going on with this. Why do I keep having pain here? And again, in this case, they did an x ray and her tailbone was out of place. So your tailbone is supposed to be kind of curved. There's like a little curve like that. Hers was straight and bent. It wasn't, it was completely out of position. And she had, in fact, sustained a tailbone injury. And for her, what fixed it was a combination of physical therapy and chiropractic so that they could restore the proper position of the bones. Whenever anybody has long-term chronic muscle tension, we always have to take a step back and ask, why is the muscle always tight in this location? Is there another anatomical reason for this tension? And so if Sue were in here, Sue had, and Sue comes to our meetings all the time, so we've talked about this all the time. She was also a patient who bladder therapies didn't work, and it turned out she's got this knot of scar tissue in her pelvic floor in exactly the wrong spot, which is exactly why when she did physical therapy, it hurt. For some people, your legs might be longer, one might be longer than the other, so you've got hips that are not level, so the hips are not working together. Some of you might have SI issues, some of you might have foot issues. And in many cases, the diagnostic workup is really about removing layers. It's about layer, 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 layer. And we can get to the point where if we find muscle tension, and the good news here is the vast majority of doctors at your first appointment will do a pelvic floor assessment. We can treat muscles. Pelvic floor dysfunction is curable. It is curable in many patients if you're willing to do the work. It's a lot of work to get your muscles back to where they need to be, but bladder pain syndrome subtype 3 pelvic floor is, according to Dr. Christopher Payne, the author of the subtyping system that we use, potentially curable. And how unfair is it that you're told that many of you are told that this is incurable? With these subtypes, we now can bring patients closer to cure. But again, that patient does not have a chronic bacterial infection. They've got a structural physical injury to their pelvis that is directly limiting blood flow to their bladder and to other organs and compromising nerves and stuff like that. And bam, that creates the foundation for bladder issues also. So I am frustrated that anybody at this point in time in the IC world would make a statement that everybody has chronic bacterial infection. It simply is not true. It is not true. And the harm that's potentially being done in that circumstance is for those of you where it's not true, if you're taking antibiotics, you're actually creating the environment for you to have a fungal infection. And so we want to try to be a little bit more fact based. If you do think you've got an infection, have a next generation urine test. That'll tell us right away. Don't just guess. Let's do some facts here. Now they're probably going to come on in and try to and be all mad at me, and that's okay. As long as nobody, I don't want to insult anybody. I'm not trying to be insulting to them. I am just saying that from our perspective, we look at IC as a pelvic pain syndrome, of which there are about 25 or 26 potential causes for urinary frequency, urgency, pressure pain that all need to be ruled out. And if you end up with a chronic bacterial infection that is proven with the next gen test, then absolutely you've got to treat it. Just like if you got a fungal infection, got to treat it. If you got a viral infection, got to treat it. I get it. I get it. All right, so I'm gonna get off my soapbox here. It was just something, it just bothers me that it goes back 25 years ago when, before we had Facebook and, when we had internet news groups, the same exact argument was made back then too. And we had people saying everybody should be on antibiotics and antibiotics are perfectly safe, and they're not safe. They're not safe, especially fluoroquinolone antibiotics, Cipro, Levsin. I mean, not Levaquin, not Levsin. They can cause an aortic aneurysm. Antibiotics are not necessarily safe. We thought they were 30 years ago. We now know that they can be very, very dangerous. So you should not be self-medicating with an antibiotic when you have a flare. We got to do the workup to figure out, are you having a bladder wall flare or a pelvic floor flare? Have you irritated a nerve, et cetera, et cetera. You guys, if you come on over to the website, IC Network, icnetwork.org, and you sign up for our free mailing list, and I only send out newsletters like once every 2 months. I completely respect your inbox because I don't like getting junk mail. I don't send out junk mail. But you will get our 40-page flare management guide that you can download, and it will give you hour by hour rescue plans. It will help you understand the type of flare you're having, and I need to rewrite it again, but it's pretty good. Is it will help you figure out the type of flare you're having, and then it will give you an hour by hour rescue plan of what you can do to try to get that flare under control. So icnetwork.org. The other thing that's happening right now is I am actually editing and doing the format for a new book on IC and pelvic pain written by Gay and Andrew Sandler. They're the authors of Patient to Patient Managing IC-Related Conditions that came out about 15 years ago, and then The Proactive Patient, which came out about 5 years ago. Unfortunately, their publisher went belly up, and the book was only available for a short period of time. We are now re-releasing that book under the IC network as a Kindle, and we have added a brand new chapter on have written for them, and I am in the process right now of editing that book and preparing it for Kindle. So that's the big thing that's happening here, right? All righty, I will get off my soapbox. Let us take some questions. If you're on Facebook, please understand that it scrolls by very, very quickly, and I miss a lot of questions. Don't take it personally, just ask it again. So let's start first with Facebook. Hello, CM. Hi, Sarah. Hi, Deborah. Hi, Helen. Hi, Sherry. Hi, Catherine. Okay, Catherine says, "Is in your educated expert opinion, is IC subtype Hunner's lesions an autoimmune disease?" The answer is no, no. I see this is also one of those, oh God, myths that seep through, that have swept through IC history for years, and that is people who believe that IC is autoimmune in nature. And again, the research from Europe shows that Hunner's lesions are probably viral infections. The only other theory that supports the development of a Hunner's lesion at this point in time is really bad neuroinflammation. Yeah, and when we look at what treats a Hunner's lesion, the only treatment in history to ever heal a Hunner's lesion is Lyris, which is a 24-hour basic infusion of lidocaine into the bladder wall. So Lyris is called the lidocaine pretzel. Imagine a soft, hollow piece of spaghetti filled with lidocaine. You stick it in the bladder. It stays in the bladder for 2 weeks, where it releases 20 for 24 hours a day, a little bit of lidocaine. And again, remember the fundamental challenge with the bladder anyway is how do you get medication to stay in the bladder? Because you pee it out. It just gets peed out, right? So Lyris was a medical device created to deliver medication for a prolonged long period of time in the bladder. So what they did is they used lidocaine. Their first goal was to create something that would help reduce bladder pain. And the first research study was done up in Canada and by Dr. Curtis Nickel, one of the top IC researchers in the world. And they were stunned in the very first study to find that every patient with Hunner's lesions had their lesions disappear in 2 weeks. The lesions, a total and complete resolution of the lesion is the language they used in the research study. So why would lidocaine make a lesion go away? What does lidocaine do? It's a numbing agent, it's an anesthetic. So the second theory of Hunner's lesions is that they're nerve driven, that it is a nerve that's basically stuck in the on position that becomes massively, massively, massively inflamed. And an inflamed nerve releases something called substance P, which is very damaging to tissue. And so by numbing the nerve, silencing the nerve, you stop the release of substance P, which would then also potentially help that wound heal. When a Hunner's lesion is biopsied, it is profound inflammation. It is remarkably different from the rest of us. When you look at Hunner's lesion tissue, there is war going on. It is massive inflammation, and inflammation is a sign that your body is fighting something. And so again, that kind of supports the viral theory. So those are the two best guesses on why Hunner's lesions happen. And in terms of autoimmune disease, when we think about subtyping, the question is, is there potentially an autoimmune subtype And the last time I read about it, there were 4 key markers, that blood markers that were required to meet the criteria for an autoimmune disease, and IC only had 2 out of the 4. So it didn't meet the clear criteria, and that was only in some people, right? Because 'Cause we've got this tremendous diversity here. Is there a small subtype of patients who have autoimmune disease? Probably. But it's probably 3 to 4 2 to 3 to 4% because we would look at lupus, Sjogren's syndrome, the other autoimmune diseases that are sometimes seen in IC patients. I would suspect that that small group of patients might have an autoimmune driven condition, but not it's not a big wide swath. And I do not recall seeing recent research that talks about Hunner's lesions being autoimmune in nature. Here, hold on a second. Hi, Karen. Hi, Arlene. Hello, Janice from the great city of Kansas City. Ginger says, "What do I know about radiation cystitis for bladder pain?" So, radiation cystitis is another variant of a cystitis. We've got several different types of cystitis. We've got eosinophilic cystitis, we've got ketamine cystitis, and we've got radiation cystitis, chemocystitis, among others. In radiation cystitis, what happens is that patient has had some sort of cancer in their pelvis, and they had to have radiation therapy. And unfortunately, radiation therapy is damaging to blood vessels. It can damage the blood vessels in the bladder wall, resulting in something called hemorrhagic cystitis. Um, and so an extreme side effect of radiation therapy to the pelvis is a bleeding bladder. And for those patients, you're generally taken into the OR and they cauterize the wound wherever it is. With radiation cystitis, Ginger, we don't have. Again, I'm kind of like going through all of the things that I've read about it. The concept of a coating might help protect your bladder wall, like Elmeron, but it doesn't necessarily fix, and it certainly would not fix the blood vessels that have been damaged by the radiation. But it's in your best interest to not harm your bladder further. And that is why something like a coating makes a little bit more sense, along with, of course, following an IC diet to protect your bladder wall. Um, I don't remember. We have a section of on radiation cystitis on our website. I don't remember if I turned it on or, I moved our website from an old website to a new website, and I don't remember if I turned that on or not. We'll have to look. If you want to call me this week, I would be happy to talk with you about it and see if I can give you a few more tips on it. It's much harder to treat, hun. I'm so sorry that you might, if you're going through that you're going through that. You're going to have to follow the diet. You're going to have to protect your bladder, and hope and pray that your bladder will begin that process of repairing itself, and those blood vessels will have an opportunity. Hello, Cara. Hi, Betty. Hello, Kelly. I'd like to know, basil infused water would help calm IC pain. No, no. What would help would be a chamomile infused water or a peppermint infused water, which have been proven in research studies to calm bladder spasms. They calm the smooth muscle of the bladder or the bowel. So if you're looking for an infused water, it would be a chamomile infused water or a peppermint infused water. Feel free to throw some cucumber in there too, cucumber slices. icdietproject.com, which is our diet website. We have a whole blog on drinks and infused waters, and it gives you lots of combinations that you can do for infused waters. But basil by itself, I don't think it's going to be helpful. I think you really want to stick with the mint or the chamomile. I mean, if you like the flavor, go for it. Amanda says, just hospitalized in April for sepsis. Oh, hon, I'm so sorry. From a kidney infection and 10 kidney stones. My urologist put off your surgery until June because of the coronavirus, but makes no sense being this sick with it. And I see during everything, so you're seeing your immune system is challenged. Amanda, I'm so sorry. Now here in California, they're just starting to reschedule optional surgery. So hopefully that will come to your area soon. I really hope so. Kidney stones are a beast, and hopefully they are telling you the type of kidney stone you have. If it's a calcium oxalate kidney stone, you want to make sure you reduce foods that are high in oxalates. And you certainly would not be able to do something like pre-leaf, which is a calcium supplement used to reduce acid. Um, So for those of you who don't know, pre-leaf is the oldest supplement that has been, gosh, it's hot, that has been used by IC patients. It's calcium glycerophosphate. If you have to go to grandma's house, not that you can right now, okay, I'll take that back. If your food is getting a little bit low and you don't have any fruit except that orange sitting there and you're dying for some fruit, but you know the orange is going to potentially hurt your bladder, you could take pre-leaf before you eat that orange, and that would help reduce some of the acid from that drink or from that fruit. So pre-leaf is a mainstay in the patient community for IC and anybody else who struggles with acid sensitivity, but it's made of calcium, and if you're prone to calcium-based kidney stones, you would not be using something like pre-leaf. Pre-leaf, uh, should not be eaten like candy. When you're desperate, when you're desperate, you just wanna try everything, and there are some of you out there who just eat pre-leaf all day. Listen, kids, the calcium's gotta go somewhere. And it's gonna end up in your bloodstream, which means it's gonna end up in your kidneys, which means it could trigger kidney stones. So you gotta be really careful and only use things that, by following the label instructions, all right? Hello, Karine from Belgium. Carol says it's 79 degrees in Massachusetts. Nancy says, "Love listening to you. Thank you." I'm a little tongue-tied today. I don't know why. Some days the words flow, and other days the words do not flow. Hello, Lisa. Hi, Carla. Hi, Amy. Hi, Angela. Amanda, I was first diagnosed with chronic kidney stones and recurring UTIs at 15, not diagnosed with IC until 25, but I feel I had it longer, just the wrong doctor. Well, you might have an inherited issue with the kidney stones and your body's ability to process calcium. That's a possibility. Gigi says the oats test also tests for fungus. Awesome. Thank you for letting me know. I've never done the oats test, so I'm not familiar with it. Hi, DJ. Hi, Sophie. Sophie says, "Nobody knows anything about IC unless they have it. No one will understand the pain that you go through." Hallelujah. So true. Oh, oh, Jamie. Jamie says, "Yes, yes. I'm so glad you've talked about my issues. I've been telling doctors for a year. I have CEBV and CMV. Microgen found candida, and so did the oats test. Mycotoxins test showed mold. You need a doctor to translate it." Oh, Jamie, this is awesome. It's awesome that we now understand that you're having a fungal driven issue and potentially a mold driven issue. TJ, asked my urogynecologist about the supplements you showed last week. She said that the only one recommended is Cystoprotec and L-arginine. I haven't been able to find much about L-arginine. Do you think it's helpful? L-arginine had, the last time I looked, 3 research studies. We did an interview with Lori Berter, University of Alabama, several years ago, who helped us explain why L-arginine has the potential of being helpful. L-arginine is a neurotransmitter involved in the process of urination. There were 2 research studies that showed that L-arginine could be helpful, and yet there were other research studies which showed that it was not helpful at all. And the reason why your doctor said to recommend Sister Protec is your doctor does not know about the new supplements because they're new. And DJ, if you want to email your doctor's name, I will pass it along to the company so that they can send your doctor information about the other supplements. Because the bladder builder is really far superior than Cysto Protect in terms of methods of action. Cysto Protect has chondroitin and hyaluronate for a bladder coating effect. It's got quercetin for the antihistaminic effect. Bladder Builder has the same. It's got chondroitin for the bladder coating. It's got quercetin for the antihistaminic effect. It's got collagen to support the bladder wall. It's got probiotics in it for the gut. It's got amino acids like L-arginine. The most important thing about the bladder builder is the PEA, palmitoethanolamide, which has been proven in research to reduce the pain. And ultimately, listen, that's why exactly a year ago we were so excited. It was exactly a year ago. So the IC conference that was in where was it? Chicago? And I couldn't go. I couldn't go, because I'm caring for my elderly parents and didn't have anybody to help me. And so I was here going through all the research studies, that were gonna be presented because I always do articles on all the new research for our website and for our magazine. And I'm going along. What do I find? The first PEA-IC research study. PEA, palmitoethanolamide, has been available in Europe for more than a decade. And I've known about it for that long because we had pharmacists who were trying to import it for IC patients 10, 15 years ago. The problem is it was massively, massively expensive. But PEA has been found to help a wide variety of chronic pain conditions, from fibromyalgia to sciatica to burning mouth syndrome. I mean, you name it, they've studied it. And you know what I'll do? Well, if you go into our store and you take a look at Bladder Builder or Peora, you can copy the name, the scientific name for it, palmitoethanolamide, and go over to the National Library of Medicine and look at all the research studies. There's massive research with this product or with this ingredient, not product, this ingredient, palmitoethanolamide. So it's exactly a year ago that we had the first ICPEA research study, and the doctors there, I was told, became very, very excited because at month 3, 87% of patients using PEA had a significant reduction in their pain. And at month 6, every patient using PEA had a significant reduction in their pain, and 25% were pain free. Pain free. And so having a supplement have a little bit of PEA in it with knowing that it might help reduce your pain, to me, is just very, very exciting and important. So many of you have been kicked off of your pain medicine and are suffering. I know because I suffered for years. Remember, I could barely walk my first year. Could barely walk. The pain in my bladder was agony. I had a chemical burn in my bladder. And I was drinking a quart of cranberry juice a day, not having a clue that it was making the wound bigger and bigger and bigger. And at the end of that first year, I was sobbing every night, laying on my living room floor, begging for God to help me. And I was going to the ER. It's terrible. I'm pain free now. I am proof that healing happens. And I did not have a chronic bacterial infection. I had a chemical burn in my bladder. All right. Hi, Sue. Hi, Dreama. Thank you, hon. Thank you very much for saying that. DJ says, as someone who's getting multi-resistant bladder infections, antibiotics definitely are not the answer. DJ, I'll tell you, I was reading about 6 months ago, and I made this prediction. In my opinion, they're in the next 5 years, they're gonna start treating bacterial infections with other bacteria that kill that infection. Um, um, because ultimately, it's all about your biome. Ultimately, there is something in your body's composition of good bacteria versus bad bacteria that is out of balance. And one of the things that patients often do, and I always try to correct them on that, is they take the same probiotic for years. It's like every year you're going to take your acidophilus, whatever. That's a mistake because there are many, many, many species of good bacteria in your bladder and in your urinary tract. I think it's really important to mix it up and be aware that you don't want to create an imbalance or an overbalance in one specific species. Diane Manhattan, who helped me start the IC network, God bless her soul, we lost her several years ago, had one. She had took so much acidophilus. She ended up with her beneficial approach became pathogenic, and it was really fascinating. It was, and I've talked to a few people that that's happened to. Diane was lost. Diane was, I don't know if you guys remember. Do you remember that nurse who in New York and New Jersey was killing people? It wasn't a nurse. It was a pulmonary therapist, and ended up being convicted of killing 25 or 30 people. She was his last victim. He was arrested literally the day after she was sent home septic, and she died. So that was a whole grieving process for us. It was terrible. But she's here. I think about her all the time. I always think Diana and I were real opposites because I came in with all these ridiculous college degrees. I had no idea why I had those degrees in the first place. I didn't know what I was supposed to do with my life. It made no sense to me until all this happened. And then I started the IC network, and Diane was a waitress. She was great. She was great. I just loved her. She didn't go to college, high school graduate, was a waitress. And in this little dive, and I taught her so much, she taught me so much. She ended up learning how to do writing and research on our website, and I showed her how to use the National Library of Medicine, and she rocked it. She wrote a lot of stuff for us. I was so proud of her. She's a wonderful, wonderful woman. Texas Red. Hello, Texas Red. I'm currently in the process of figuring out my subtype. Why are pudendal neuralgia and pelvic floor dysfunction separate? If PN isn't caused by dysfunctional muscles, what would cause it? A skeletal abnormality could cause pudendal neuralgia, and injury could cause pudendal neuralgia. So it's not just tight muscles. In this book, as an example, one of the most common causes of pudendal neuralgia is bicycle seats. And when you sit on so think about it, you're all sitting down right now, or most of you are, right? Okay. If you were sitting on a bicycle seat, especially kind of the narrow bicycle seat that's on the competitive bikes, it literally is pushing right up into your pudendal nerve. And so it becomes bike rider's syndrome. And he has a really this is the book, people, Breaking Through Chronic Pelvic Pain. This is a book every single one of you should have. It's so freaking good. Joan says, "Yes, I can't ride my bike anymore." He's got a great picture right at the end. Let's see if I can find this picture. By the way, there's something. Oh, here it is. Okay. So look at this picture. I'm sorry. Ah, it's so hard to do this. Okay, so look, there's the bicycle seat, right? And that's you sitting on the bicycle seat. And it actually shows, although you cannot see it, exactly where it's compressing and damaging the pudendal nerve and the nerves. He talked it now, let me just say something here. This is so, and they call it cyclist syndrome. Have you ever heard of something called proctalgia fugax? So Proctalgia, proctalgia fugax. You see that right there? This is interesting. Proctalgia means pain in the rectal area, and fugax means fleeting pain. And it's a stunningly deep pain that um, might last for a couple of minutes and then it just goes away. So in 2006, an international group of gastroenterologists gathered in Rome to collect data that would help physicians diagnose, classify, and treat functional GI disorders. Um, and to make this diagnosis, number one, you must have recurring episodes of pain localized by the rectum, episodes that last from seconds to minutes, and an absence of pain between episodes. So in other words, you're fine until it hits, and when it hits, you cannot freaking move. You're sitting on your toilet or you're on your hands and knees, and then it goes away. Anybody ever have that? It's like this sudden, deep. It comes on suddenly with only a brief premonition that it might be coming on, and during attack, one may be completely incapacitated and unable to move. While generally the severe spasm lasts from seconds to 5 minutes or so, some patients reported episodes lasting 10 minutes or longer. The attacks are sporadic, recurring at unpredictable intervals from weeks to months and at any time of the day or night. Patients have compared this pain's intensity to childbirth, kidney stones, or gallbladder attacks. As for the quality of pain, the descriptions run the gamut between cramping, gnawing, and sickening to like a sharp object piercing the rectum or like being squeezed by a vice. So what causes it? Like that's happened to me. It happened to me a lot in my 20s. Um, so interestingly, they're going back to tight muscles with this. So he says, I feel comfortable declaring pudendal neuralgia and spasms or trigger points of the pelvic floor muscles, particularly the puborectalis muscle, to be the cause of the severe rectal pain. An interesting study conducted in Japan supports the pudendal nerve cause. Um, Dr. Takano reports that in almost all of 68 patients, a point of tenderness was found corresponding to the pudendal nerve. The nature of the pain caused by pressing the point was recognized by the patient as similar to what they experienced in the attack, and they found that by blocking the nerve, they went away. Yeah. Texas Red said, I have episodes like that. It's sharp pain. Yeah. Yeah. I don't know if you're a man or a woman, Texas. I'm just going to call you Red. Get this book. It's free on Kindle Unlimited. It's free. And I will tell you, the discussion is on page 370. So, and remember what Dr. Weiss talks about in this book, and I think we all recognize that this is the challenge for people who are in pelvic pain, is that the doctor that you see is comfortable staying in their box. They don't look outside of their box. So a urologist is going to stay in the urinary tract. A gastroenterologist is going to stay in the gut and in the bowel, and a gynecologist is going to stay in the reproductive area. And it's very hard for them to look outside their area. And what makes Dr. Weiss so special is that he really talks about how the muscles can trigger problems in all of those areas. YouTube, let me go back to YouTube here for a moment. Nancy says, my doctor is having me try Myrbetriq 25 milligrams. Good luck. I hope it helps. The advantage of Myrbetriq over ditrophan or Detrol is that it is not an anticholinergic medication, and therefore you don't have the risk of cognitive decline or dementia if you use it for a long period of time. The other problem with Myrbetriq, though, or the problem with Myrbetriq, though, is that a lot of health insurance companies don't cover it, and it can be quite expensive. Lauren says, hi from Oklahoma. Jill, I've been reading the Vagina Bible as you recommended, and I'm loving it. So many myths have been debunked, and I'm telling all of my family and friends. Guys, if you haven't seen this book, For women, this is the other must read. This is a must read book. This is a total mythbuster book. This is the book that talks real life advice for real life issues, like can you use soap down there? What do you do for this? What do you do for that? For anywhere from intimacy and sex and HPV and pelvic floor spasm and vaginismus. Here's a chapter. I have an odor. There are an increasing number of women reporting abnormal genital odor. I'm not the only OBGYN to notice this. There has been no change in causes of genital odor over the last 20 years. What has changed is the proliferation of products designed to shame women about the normal smell of their body and tame the female genital tract for some misogynist ideal. These products come from big pharma and are found on drugstore shelves in the form of douches and intimate washes, and they exist in the realm of the big natural with vaginal steaming and vaginal herbal sachets, often called pearls. With vulvovaginal odor, 2/3 of the time a vaginal cause will be identified, and 1/3 of the time the exam and testing will be completely normal and there will be no medical cause. This is a great book. Yeah, like seriously, give it to every woman in your family, no matter their age, from teenage to 80 years old. This is them. Curtis says, I recalled another significant event that might have caused my bladder injury. In 2002, I had hemorrhoid surgery. I was sent home with a catheter because I couldn't pee. Ah! Okay, so like seriously, guys, seriously. Hemorrhoid surgery is about the most painful surgery you can have, right? Like, holy hell, that is uncomfortable. And what's interesting is you were sent home with a catheter because you couldn't pee. I wonder why you couldn't pee. Was it just muscle spasms? Generally, guys, if you ever have a hydrodistension and you're sent home with a catheter, that means they damaged your bladder. You're normally not sent home from the hospital with a catheter unless something in the urinary tract needs to heal. Curtis said, you got it removed, then had to go to the ER because you still couldn't pee. They had to give me another catheter, which was left in for a couple days. And I was finally able to pee on my own. I've read that about getting hemorrhoid surgery. This is pretty common problems afterward because the muscles get damaged. The muscles get damaged or they just go in an extreme tension guarding reflex. It seems like my pressure, pain, and frequency problems slowly progressed after the surgery. Coincidence, or do you think these events are what caused your IC, your subtype bladder wall driven? Well, you got to remember the chicken versus the egg. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. The reality is that they're both involved because they're so incredibly interconnected. The challenge here is figuring out which is primary and which is secondary. So if your IC began after chemotherapy, then your bladder screaming in pain because the chemicals have damaged your bladder wall, then your pelvic floor is going to get tight in a guarding reflex to protect you. Our therapeutic priority for that patient is to calm and soothe the bladder. Yeah, I think you're in the other group, hun. I do, because if it began after surgery, then it began after trauma. So we can either say muscles were cut, muscles were damaged, or the pain of the surgery was so intense that your muscles just locked down in an extreme guarding reflex. And the only thing I can compare that to is when I had my hysterectomy 3 years ago. 4 years, no, 3 years ago. Um, I I could not have a bowel movement, without crying for, like, a month because everything down there was so traumatized and painful. Curtis, I've talked about this before. We've got the viscerosomatic reflex, which is how an organ can change a muscle. So if your organ is in pain, your muscles are gonna get tight. That's called a guarding reflex. So we know organs can influence and change muscles, but we also know that muscles can change organs. That is a somatovisceral reflex. I would suspect that that's probably what's happening with you. is that your muscles were just so badly messed up after the surgery. How I don't see how they wouldn't be. That your bladder wall started to break down because of the nerve trauma and all that other stuff. That would be my guess. Diane says, I'm having, hold on a sec. Diane says, I've been having a constant feeling that I have to pee. It's driving me insane. I do not have a UTI. I'm also having lots of pain in my urethra. What do you suggest to stop the constant feeling? My doctor is not seeing patients due to the coronavirus. Okay. So Diane, frequency urgency comes from the alpha afferent nerve in the bladder wall. That is, so we only have two distinct nerve groups in the bladder. We've got the alpha afferents, which control frequency urgency, and then we've got the C fiber, which controls pain. So anytime you have a bladder issue, the first symptom you're going to feel is frequency urgency. So operating on that assumption, we have to think number one, is there something consistently that's irritating your bladder wall? Could you, for example, be an estrogen atrophy patient where your bladder wall is just not thick anymore? You don't have that nice thick mucosal barrier. Therefore, literally the nerves and the skin are more exposed and more vulnerable. And so if your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. So we would want to look at the quality and health of your skin. We would want to look at your food. Let's make sure you're not doing anything irritating. But I really think too, we have to accept and understand that conventional urinalyses are not effective anymore. We know that they're not effective. If there is even a remote chance that you might have a fungal infection or a bladder infection, having a next generation urine test, I would do it because I like data. I don't like guessing. If I'm suffering, I want eyeballs on the organ. I want somebody to look and I want somebody to study. I don't want anybody guessing about me. We did that for 9 months with what turned out to be uterine cancer, and it could have killed me. If we had just had the test when we first saw it, my life would have been a lot easier, but we waited and the doctor guessed and I guessed, and that was a mistake. And I paid potentially dearly for that. That was an awful, awful year, as you guys know. And so the advantage of a next generation urine test is it would allow you and your doctor to see what's in there, if anything that's dysfunctional. And if you have no fungus, that's great news. And if you've got nothing weird coming up with your bacteria count, then that's good too. Then we have to look at other things like, is there something else that's pushing on your bladder? Do you have a fibroid tumor that's pushing on your bladder? Do you have endometriosis? Or do you feel a falling sensation, like something's falling out of you, which would tell us that your pelvic floor is the problem? There are a lot of potential things that can cause a frequency urgency. In the meantime, while you're right in the midst of it, number one, you got to fix your diet. You shouldn't be doing any coffee, any tea, any soda, anything at all like that. I would be doing chamomile herbal tea or peppermint herbal tea because that is proven in research to calm the smooth muscle of the bladder. Um, um, You could try some of the supplements, but they're not gonna act quickly, that's the problem. But still, something that would give you a little bit of a coating like the Bladder Builder or the Bladder Rest or the Cysto Protect or the Desert Harvest Aloe might be reasonable, but we can't really have a good discussion about what your treatment options are until we really have a better understanding of what might be going on, which is subtyping. If your muscles are super tight, that could be causing the frequency too, you know? Now, again, guys on Facebook, please know that the questions scroll so quickly and it doesn't let me scroll back and I miss them. So if you said something on Facebook and I've missed it, please don't take that personally. I cannot scroll back. It does not allow me to scroll back. Thank you, Cheryl. Hello, Vicky from Kansas. Sophie says, bladder installations sometimes make me worse. Sent me to the hospital last time. So, Sophie, what kind of bladder installations? There are a lot of different bladder installations out there. Was it a DMSO installation? Was it a heparin installation? Or was it a Elmeron installation? Or was it Ioloril or a cystostat? Can you tell us which one it was? Jamie says, it's interesting about the autoimmune theory. I was told from a uro Said it's lifelong and you will need to be on oxybutynin your whole life. Jamie, there's a big problem with that. And that is that oxybutynin has now been linked to cognitive decline, dementia, or Alzheimer's. And in a research study that was presented last year, what they found is that if you took it every day for 3 years, and you were over the age of 50, that it dramatically increased your risk of cognitive decline. Oxybutynin is an anticholinergic. That is not good advice from your doctor, in my opinion. And I would instead be looking at something that has chondroitin in it that might be more helpful for your bladder wall. You need to, if you can, come on over to our website, icnetwork.org. And I think I have a blog on the latest FDA alert about oxybutynin. And it was really quite dire. So, what it found was that the anticholinergic medications that are commonly given to IC patients, which are the Elavils, the nortriptylines, the imipramines, along with the antispasmodics, the detrols, the ditropans, the oxybutynin, were pose significant risks of cognitive decline. Brittany says, I've noticed occasional burning, tingling in my hands and my feet, more often on my left side. Usually happens 30 minutes after I urinate, not every time I pee. Oh, you guys, it's scrolling too fast. I can't finish it. Brittany, I'm sorry. I couldn't get through it. Claire, Claire. So, hun, listen, I respect your perspective on chronic bacterial infection. I do. I get it. I do believe that you had that, and I do believe that it helped you. But we cannot make blanket statements about everyone else. And no, I have not had a chance to contact Dr. Bundrick, but I will. It's on my list. Giant, giant to-do list. And you know what? Let me just I just want to say, listen, I'm the only group that talks about it, at least. Give me a little bit of credit here. Cheryl says, I'm taking Elmeron once a day, have been at that dose for many years now. I'm recently reading about Elmeron eye damage. Our doctor's looking at other options. This has been so effective for me. Yes, Cheryl, what they're doing. So a better way to use Elmeron is to use it in a bladder installation where it just goes directly in the bladder and it doesn't go into your bloodstream to any great degree where it can get to your eyes. And you can read about it on our website. Beverly, is it okay to get into a hot tub? The answer is it depends upon what kind. Some hot tubs, depending upon who's managing the chemicals, can be quite harmful. Chlorine-based hot tubs can be a bit more damaging than the other type, which I forget the name of the other type. Barbara says, bladder builder question mark. Bladder builder is a supplement. It's one of several supplements that patients have used for years now. So this is Bladder Builder. This is one of the newest ones, and it's developed by a team of doctors and researchers and myself and another person. Barbara says, PEA, where can I get it? You can get it right on our website. It's called, we actually, after the research study was presented at the ESSIC meeting, the Natural Approach Nutrition made a PEA supplement. It's called Peora. And it's under $30. And this is the only supplement that I take when I feel it, start feeling nerve pain. Diane says, I've been having the constant feeling that I have to pee, even though just a small amount comes out. This is driving me insane. Gabapentin, hydroxyzine, Valium, tramadol does not relieve the symptom. What do you suggest? I'm also having urethral pain. All right. So, Diane, one of the ways the bladder wall tells you that it is irritated is with a false sense of fullness, where you feel full even when you're empty. And so, Linda, is PEA the same as Peoria? Yes, same thing. Okay, so let me describe a typical flare. A typical bladder wall flare, which is the type of flare I had after my chemical burn. Okay, so you go to bed at midnight. Of course, you've emptied your bladder. You go to bed, you wake up an hour or 2 later, your bladder feels really full. You go to the bathroom, you pee out a quarter cup of urine. You go back to bed, you wake up 30 minutes later, your bladder feels very, very full. You pee out maybe a teaspoon. You go back to bed, you wake up 15 minutes later, your bladder feels very, very full. You sit and strain, and you get a drop. That is the perfect sign, that false sense of fullness tells us that your bladder wall is screaming for help right now. And that is usually the type of flare that we see with a very strong acid triggered flare. And so, normally, for flares that are that intense, we look for a daily irritant. Is there something in your daily life that is provoking your bladder? Are you drinking alkaline water all day? That's a mistake. Bleach will irritate your bladder just as sulfuric acid will. So some patients will do way too much alkaline water, and that becomes irritating. Or if you're taking a multivitamin every day, um, that's what we want to look at. Is there something in your daily life that is provoking your bladder wall? So if he says, I took Elmeron for several years, but I read that and quit taking it. Yeah. Lillian says, my pain is managed by supplements. Not sure if there's PEA in them. Well, yeah, check. Again, proven by research, specifically with IC. Karen, let's see. DJ says, my vaginal Valium isn't a suppository. I literally have a prescription for Valium pills that I insert vaginally. I had a hysterectomy at 33, 6 years ago. I have a cuff and sometimes the muscle cramps. Girl, holy hell! I know exactly what you're talking about there. Normally, Valium is uh, made into a suppository that you can insert vaginally. It's a bit off label to put a pill directly into your vagina, but some doctors have had patients do that. The suppository is much either. Claire says, all I'm doing is knocking this treatment. So you guys, this is how we started. This is how I started the meeting, is I wanted to talk about this because, you know, um, again, I do not believe in making broad straight statements about IC. I do not believe in saying everybody but with quote unquote IC has chronic embedded infection. I simply do not believe that. I don't believe that that is true in any shape or form. The the 2 doctors who are supporting that theory recommend long-term high dose, or not, I'm sorry, high dose antibiotics that are basically long-term, up to a year use, in some cases even longer. When we go back to Dr. Fugazato, I was a Dr. Fugazato patient. I did long-term antibiotics, Claire. They did not help me at all because I don't have a chronic embedded infection. I had a chemical injury to my bladder. We know that now. We are getting much better understanding the many different things that can trigger bladder wall injury. But there is, given given the massive increase in drug-resistant infections, there is no hospital or medical system today that is not careful with their antibiotic stewardship program. We know that the reason why antibiotic resistant infections develop is because of the overuse of antibiotics. So there are going to be very, very, very few people, including many urologists, who would ever go for high dose antibiotics for a year, hun. They just won't do it. And it's really up to to that side to present the data. Publish it in a journal, get other doctors to look at it, and try to get them over to your cause. But what we know right now is we've got people dying of antibiotic resistant infections, including antibiotic resistant candida infections, which are caused by the overuse of antibiotics in the first place. So we can't say it's safe right now. It's a risk. Antibiotics, whatever it is, it's risky, and every patient needs to know the pros and cons. Lauren says, I got in touch with a lawyer about the Elmeron eye issue and just got a letter in the mail saying the statute of limitations may be an issue. What the? No, no, no. We've got an attorney who is currently writing something for us right now that's going to go out in our next magazine, and I will make sure that that's included in that. We did not know about the eye issues until a year and a half ago. Period. No one knew. So I don't think that that argument is gonna fly. Have I heard of any good lawyers associated with the Elmeron lawsuits? Yes, there are 2. If you go to elmeroneyedisease.com, that's one attorney who is doing it, Michael Jansen, whose wife is an IC patient who took Elmeron. He called me within a day of the first paper coming out. And then we also have another attorney, legal firm up in Minnesota who filed the first case in U.S. District Court in Connecticut last month. And the name of that firm is, let's see, I just did a blog on it. I didn't remember the name off the top of my head. Johnson and Becker. So if you go to our website, the first blog is you'll see a woman with her hands over her eyes as the picture. That gives the name of that firm. Okay. Lillian says, "Once she got a punettal nerve blocker, pain went away." Awesome. Alice says, "Strangely, I'm taking bone broth every day because it has all the ingredients to help the bladder walk. Chondroitin, hyaluronic acid, glucosamine. Tastes okay too. All organic, has really helped." Love it. Awesome. David says, "Miratrick made your IC prostatitis very bad." Interesting. Well, some people have reactions that are exactly the what the medication is intended to do, and it may be that you're just in that group. Your body just doesn't tolerate the medication. Amy said, "I was told that what my partner eats or drinking stuff hurts you, that will cause pain during sex." Amy, no, that's not true. Especially if you're using a condom. Pain during intimacy is related to muscles. It's related to muscles mostly, and of course, if you've got a really irritated, tender bladder and putting something hard up next to it, yeah, that's gonna hurt too. But uh, there are some women who have been allergic to the semen or sperm of their partner, and of course, there are some people who have issues with latex if you're using a latex condom. But I've never seen anybody prove that statement that what your partner eats will hurt you during sex. I don't think so. Rebecca said, "Should we take antibiotics for an embedded infection? What do we do? Just leave it? Not a good idea. Is easily advised by anyone." Well, like I said, Rebecca, earlier, I think we're going to get to the point where we're going to start treating infections with other bacteria, which are the bacteria that would normally keep the pathogenic bacteria under control. And they're also using bacteriophage therapy, which is another way of introducing something that would kill that bacteria that doesn't present the same risk as using a broad spectrum antibiotic that can damage so much else. And nobody's telling you to leave it. Nobody's telling you to leave it. I'm not telling you to leave it. If you've got a bacterial infection, treat it. Absolutely treat it. There just aren't many doctors who are gonna support long-term use, son. They're just not. We have all these antibiotic stewardship programs going on in hospitals and doctors' offices everywhere. Why? Because they're trying to save lives. Because it is an undeniable fact that candida, drug-resistant candida, is a direct result of the overuse of antibiotics, and drug-resistant candida kills people in hospitals because it becomes become septic with it. So, it's not about it's not nobody's choosing sides here. It's about making an informed decision about the risks. If you have a doctor who's willing to give you long-term antibiotics and you want to do that, that's fine. But you should be informed of the risks, especially with anticholinergic medications, because if you were taking Cipro long term, the odds are you could end up with an aortic aneurysm. And again, we're not making broad statements here. For that patient who fell on their tailbone and their symptoms started after that, they do not have a chronic bacterial infection. They've got a tailbone injury, a nerve injury. Antibiotics would be completely inappropriate for that patient. And you're saying that we cannot trust the World Health Organization? I just don't even know what to say about that. That's really sad that you think that. Diane says, "I don't know what to do to relieve this. I'm in misery." Diane, if you wanna call me, I would be more than happy to talk with you, hon. GJ says, "I'm waiting for a hydrodetention, but elective surgery is still on pause due to COVID. My doctors are all on the same page and advocating for me." Cara says, "Every procedure I've had, I've been sent home with the Foley catheter. Otherwise, I have retention issues. Now my bladder can only hold 200 mLs max. Otherwise, that's when my pain amps up." So Cara, there's something called a waking bladder capacity versus an anesthetized bladder capacity, and that's a really interesting. It's really interesting to look at the differences. Because if you're asleep and they can put 1,000 cc's of fluid in your bladder, that tells us that your bladder capacity itself, that the bladder muscle itself is functioning okay. It's the nerves that are the problem. So if on a waking bladder capacity, your waking bladder capacity is only 200 ml, then what that tells us is your nerves are super, super, super sensitive. And the question is, why are you having retention after every procedure? Are you just going into muscle spasm every time, or are you over anesthetized? I mean, that's unusual, hun. It's unusual that you would be sent home with a Foley every single time. What kind of procedures are you having where you've had to come home with a Foley? Sophie says, "With the problems I'm having, do I go back to the OBGYN or urologist?" Both. Sophie, both. Go to your OB/GYN, get your pelvic floor checked. Rule for other things like fibroid tumors, just have that discussion. Quality and health of your skin. Are you showing any signs of estrogen atrophy? Have them look at you down there. And the same thing with your urologist. You know, the American Urology Association says very clearly, if you're not responding to therapy, if you're getting worse rather than better, then it's time to take a step back and revisit the diagnosis. Are we treating the right thing? And what we find is a lot of things get missed. A lot of things get missed. And so it's important. Somebody asked me this week, "Well, I have to take a medication my whole life." And the answer is no. No, no, no. We have to, but what we have to figure out is it helping you? And specifically with Elmeron, is it helping you? And when somebody asked Dr. Parsons that question, what he said is, "No, you don't have to take it your whole life. We just have to see if it's helping you or not." So how do you do that? You just gradually reduce the dose. And if as you reducing the dose, if the pain starts to come back, then that bladder coating is helping you. Granted, you might switch to a different bladder coating rather than Elmron because of that. Karen says, "What are the side effects of Mirbatrix? I'm having trouble emptying my bladder in the morning and also having ringing in one ear. And you never had these problems before. You started taking Mirbatrix 11 weeks ago after Detrol." My ears ring all the time. I took one Bactrim and I had it's a there's a specific name for it, like audio toxic reaction where your ears just start ringing with certain medicine. So you need to tell your doctor that your ears are ringing. That's important. But let's take a look. Let's see if whoops. MYRBTR. Oh, girl. Yes, 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 yes. Side effects of Myrbetriq: difficulty emptying your bladder, weak urine signs, signs of dangerously high blood pressure. If you have a buzzing in your ears, you need to call your doctor tomorrow and tell them that you're having this problem. It can raise your blood pressure. Side effects: mild headache, dizziness, painful, difficult, urgent, frequent urination, stomach pain, constipation or diarrhea, stuffy nose, sneezing, dry mouth. The serious side effects of Myrbetriq: fast heartbeat, pain or burning when urinating, difficulty emptying your bladder, weak urine stream, signs of dangerously high blood pressure, including buzzing in ears, anxiety, confusion, palpitation, shortness of breath, chest and or allergic reaction, hives, rash, itching, chest tightness, swelling. That does not sound good, Karen. You need to call your doctor and you need to let them know you're having those side effects right away. Like that's going to be the right medicine for you. You know, um, things like the antispasmodic medications, what they do is they kind of deaden the muscle, the smooth muscle of the bladder. And so what you find over time, like with ditropan, that it just gets harder and harder to pee. And that's why people stop using it. That's why I stopped using it. DJ says, when I woke up from my radical hysterectomy due to endo and adenomyosis, I know that's misspelled. Isn't it adenomyosis? I think that's what it is. As well as 5 large fibroids. I was 33. I was in the PACU, and as soon as they removed the catheter, I immediately felt the urge to pee. Then I spent 3 hours in the bathroom. Then I got to recovery, spent another hour in the bathroom. Then they sent me home. Girl, I hear you. We were 45 minutes from home, but it took us 4 hours to get home because I had such urgency. Does this sound like a bladder injury? Also, I wasn't given estrogen for almost 8 months when I first met the urogyne. Well, listen, man, that's what you call post-operative recovery, you know? Um, the anesthesia, it's, depending upon the type of anesthesia they use, what they have to do is they really have to deaden the nerves in the pelvis, and so that's why you couldn't pee afterwards. And that's why, the first 24 to 48 hours after you have major surgery like that, slowly it starts to come back, but then of course the pain comes back because you're no longer anesthetized. I would say that that's probably just a reaction to the anesthesia, but that would be a very, very good question for your doctor. I don't think that that was injury. If they sent you home with a catheter, then and you had blood in your urine, then yeah, you would have had a bladder injury. But it sounds more like it was just a lot of anesthesia. Rebecca says microgen and all other urine tests are flawed. The bladder is not sterile. There is an overlap between patient and normal controls. This means it's not possible to know which bacteria is pathogenic. For example, E. coli, mycoplasma, ureaplasma can be found in a normal bladder. That's true, and it's not true. Yes, some of them can be found in a normal bladder, but it's about the quantity that they find. But the greater value of the next generation test really is the identification of drug-resistant genes, as well as the identification of fungal infections. And yes, it's true. We are still at an early point where we're trying to understand exactly what the urinary biome is composed of. And yes, it depends upon where you are, where you live, what you eat, all that sort of things. They're going to greatly influence the bacteria that is found in your body. But it is a solid piece of intelligence. It is a solid piece of data, because if you come back with a significant population of E. coli, and if it identifies a drug-resistant gene in that E. coli, then at least you will be able to make an informed decision about what to do next. It's not guessing. Basically, what you're suggesting is that people just guess, that you're just guessing about the species of bacteria and the type of bacteria, and that's extremely uncomfortable for anybody with a medical degree. Is no, we don't wanna guess, we wanna try to identify what it is, and that's why the next generation testing is so good. You go to bladderhealth.org, and people can learn about it, bladderhealth.org, but ultimately, to me, when they identify DNA found in your urine, and they are able to then identify the species that it involves in, and then they compare that DNA with the big databases at the Center for Disease Control to look for drug-resistant genes, that's important. That's good, useful information, because if you've got a drug-resistant gene to, um, what is mine? I had a really weird one, um, amikacins. So whenever I've had a next generation test, I always have resistant genes to amikacin antibiotics. Like, I've never taken an amikacin antibiotic. I have no memory of ever taking it. Maybe when I was a kid, but more likely I got it from food. Hello, Joan. All right, let's go back to, okay, let's see. Catherine here says, "Can you point me to the fungus infections in hunters?" Yeah, if you go into our winter magazine, I've got the latest fungal studies from the MAP Research Network in our latest summer or our latest winter magazine, which is this one. So for those of you who are members of the IC network, you can't. This is in our latest magazine. So we do magazines 4 times a year. And it's all on feature stories featuring interviews with experts, as well as featured stories on new and interesting things. Like, the big feature story in this issue is, could mold toxicity be causing your symptoms? And we now know that some patients are having reactions to black mold in their home, and when the black mold is resolved, guess what happens? Their frequency urgency goes away. So we also have a wonderful interview with Dr. Jerome Weiss, the author of Breaking Through Chronic Pelvic Pain, et cetera, et cetera. Or you can go to PubMed, PUBMED.gov. That is the National Library of Medicine. Just search for interstitial cystitis or MAP Research Network. Joan says, "Do you get a fever with IC?" Well, no, you do not. You do not get a fever with well, let's see. Let me take that back. I don't think I've seen a single research study which shows that fever is consistently found in IC patients. Fever is a sign that your body is fighting a pathogen. And so the vast majority of patients do not show signs of fever, especially acute fever. And when we look at the subtypes, subtype number 1, Hunter's lesions, I would think that if somebody's having a really active viral outbreak, fever could be possible. IC subtype 2 bladder wall driven, if it's estrogen atrophy, if it's a chemical injury, if it's radiation cystitis, if it's chemocystitis, we're not going to see fever. IC subtype 3 pelvic floor muscle, no fever. IC subtype 4 pudendal neuralgia, no fever. IC subtype 5 central sensitization, no fever. So I think the only context where we can expect to see a fever are going to be some sort of infectious process. And so so again, in that case, if you've got fever, you should be screened for bacterial infections, fungal infections, etc. Gigi says, I had the oats test done and it said I have fungus. Does the microgen test tell us what fungus it is? Yes, they will identify the species of fungus you have as well as at least tell you what it might be resistant to. So yes. Shelly. Shelly, oh, hon. Shelly is starting chemotherapy on Wednesday. How will that impact the bladder and pelvic floor? So, Shelly, there are some chemo medications that can be quite irritating to the bladder wall, others that are not. And so there is a medication that they can give you that will calm not all, some of the bladder irritation you might experience if you're taking the irritating one. And I have an article on that on our website. Let me see if I can find it here. Hold on a sec. Let's see. Whoops. Oh God, I almost accidentally turned off our YouTube stream. No, that would be very, very bad. Okay, hold on. Let me see if I can find that for you. I've done articles on chemo on our website. Yeah, 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 yeah. All right. So if you just come on over to the IC Network, icnetwork.org, and just search for chemotherapy, and it goes into it and tips on how to survive chemo. So the name of the medication that you could take to protect your bladder is called Mesna, MESNA. Or you could do either some of the supplements or even Elmeron installations, something like that. But so here are the tips for surviving chemo. Number one, inform your oncologist that you have IC. Bring them educational materials about IC, such as our fact sheet or the AUA guidelines. Number two, if you have Hunner's lesions, have them treated before the onset of chemo. Number three, ask your oncologist chemo to reduce your bladder irritation, i.e., Mesna. Number four, ask your urologist about any other bladder meds that you can use during chemo to minimize bladder irritation, such as a bladder coating. Number five, drink plenty of water to dilute your urine. Number six, follow the IC diet to avoid irritating your bladder more. Number seven, if you're struggling with pain, ask your oncologist or urologist for pain medicine. And then during chemo, if you see bloody urine, pain in your lower back, you can't urinate, or you have a fever over 100.5, call your cancer team immediately. So anyway, hon, got a whole blog on it over on our website. All right, it comes up all the time, and I'm sending you so much love. I know that you're in a scary place right now. Know that I see patients get through chemotherapy all the time, and we know basically what to do now to try to protect your bladder, and that is Mesna. Follow the diet. Maybe look at rescue installations or bladder installations if you need them, like a heparin lidocaine installation. Pelvic floor spasms not as common, hun. Not as common. But again, if your bladder is in pain, your muscles are going to get tight to protect you. So having a little bit of a muscle relaxant available if you do feel pelvic floor spasms would be a reasonable request. Ask your doctor if they agree with that. Maybe they can give you some Flexeril or some baclofen that you can take at night or during the day if you start to feel spasms. I don't know if there is a contraindication though between an antispasmodic and chemo med. You've got to talk to your doctor about that. So guys, I don't know how many times I can say this, and I'm just gonna keep saying it because I feel that it's very, very for anybody in this room, anybody in this support group to tell everybody else that they all have chronic bacterial infection. It's not true. If you spike a fever, if you're peeing blood, that's a whole nother story. You got to get yourself checked. But we're not going to support any broad statements. Every IC patient has chronic bacterial embedded infection. It's not true. Shelley says, anything I can take in advance of the chemo to protect the bladder. Anything that has a bladder coating effect, Shelley. So bladder builder, bladder rest, Cystoprotect, Elmeron, if you're comfortable with the risks of the Elmeron, anything that has a bladder coating effect. Nance says, "My IC was caused by ketamine coda. How can that be? How would that be treated?" Nance, it would be treated the same way that IC subtype 2 would be treated, bladder wall driven. So you're not alone, hun. In fact, we're the only group that does support for patients with ketamine cystitis. The challenge with ketamine is that it is extremely caustic to the urinary tract. So you have the equivalent of a chemical injury or chemical burn in your bladder. So you've got to follow the IC diet, and you're going to have to try some treatments to protect your bladder wall, to give your bladder wall time to heal and repair itself from the damage. Healing is always happening. That never stops, my friends. You can count on the fact that your body is absolutely trying to heal whatever's going on. The challenge is that we get in the way of that healing. And when it comes to chemical injuries to the bladder wall injuries, the way we get in the way is by pouring acid on the wound every day or pouring, too much alkaline, sodium bicarbonate on the wound. We'd be just as irritating as acid. So, Nance, you got to follow the diet, really clean everything up with your diet, and do something like a coating. And again, that's going to be really, honestly, I think the bladder builder, because it has the pain fighting ingredient in it, would be a very interesting choice for you because ketamine cystitis can be quite painful. Um, I have a website on ketamine cystitis. I think it's ketaminecystitis.org that you can go read and check out, hun. We have all the history of all the ketamine research studies, as well as what they're saying about treatment for ketamine, and it's identical to the basic treatment for bladder wall driven. So for IC, so protecting your bladder, following the diet, et cetera, et cetera. And healing does happen. It does happen. Gigi says, we checked with UCSF and they don't have your records on back that you were on Elmeron, so you have no proof. Let's see what the attorneys say about that, Gigi. Carly says, IC is a horrific and awful disease. That said, many are given an IC diagnosis that do not have it. Clinicians need to be educated too. Girl, thank you. Absolutely. Absolutely. There are so many confusable conditions now that have to be ruled out. And that's a limitation with IC care right now. Is specialists only work in their box. They don't look outside their box at other structures in the pelvis. And so looking at muscles, looking at the viscerosomatic reflex and the somatovisceral reflex, which can both be involved with bladder problems, is important. Let's see. Brittany says, my urologist thinks tight pelvic floor muscles are causing my urinary symptoms. She let me try a few installations while waiting to see the physical therapist. They help with my most bothersome symptoms, but while they're in, but once I pee it out, the symptoms resume. Does this indicate more of a bladder wall injury? Well, I mean, it's absolutely telling us that your bladder wall is the source of your pain. But the question is, we don't necessarily know if it's primary or secondary, because if you've got tight pelvic floor muscles, that is going to influence the bladder wall and potentially cause the bladder wall to break down also. So I think the key point here is, when you go to the physical therapist, what are they finding? Are your muscles tight? Joan says, how do you feel about taking Uristat or Azo for symptoms? Azo is a bladder wall anesthetic. It can be useful in a pinch for a bladder wall flare, but it's not going to provide long-term relief because you're not meant to take it long-term. Nance says, how would my IC that was caused by ketamine treated? Nance, I have a website, ketaminecystitis.org. You can go over there and check the same way IC is treated. Protect your bladder wall, follow the IC diet, make sure you're drinking plenty of water. The IC protocol is what we use for a ketamine protocol. And of course, don't use any more ketamine, because the ketamine is incredibly damaging. DJ says, I have type 1 diabetes. So here you go. So DJ says, I have type 1 diabetes. My diabetes and I feed off of each other and create this never-ending cycle. I have bladder wall estrogen atrophy and get bladder infections monthly. I also have a nerve injury. So, so this is a case where, when you have estrogen atrophy, your bladder wall gets thinner and it loses its ability to defend itself, right? Your bladder relies on estrogen to produce mucus. When you're young and you have a lot of estrogen, you have a lot of mucus in your bladder, and you can get away with a lot of stuff. When you're older, you have much less estrogen, much less mucus. Your bladder wall is much more vulnerable. So your bladder wall is going to be irritated by food and other chemicals more easily. And yes, you are absolutely going to be more at risk for infection. In the research studies done with women, postmenopausal women who get recurring infections, generally what they find is that the bacteria is in the vagina 24 hours before it arrives in the bladder. So part of the therapy is not only doing the antibiotic, but also making sure that you're using the estrogen cream that they normally give you vaginally, so that we can improve your vaginal defenses, because the goal here is to give your body what it needs to defend itself. And just taking antibiotics over and over and over again, there are risks. There are just risks with it. But we know what your problem is that you've got severe estrogen atrophy. And so giving that tissue a little bit of estrogen so that it can produce more mucus is also considered equally important. But DJ, you might want to consider trying. I mean, a lot of doctors recommend Allura for patients like you struggling with recurring infections. Prevent is new, and it also it's a stronger formula. It's an over-the-counter formula, stronger than Allura, also designed to help prevent E. coli-based infections. And so this is the same company that made made this at the request of one of the top IC researchers who wanted an alternative to Allura that was more affordable, and it is Prevent. It's been available now for about a month, and they've been using it at the top IC research center in Michigan, Beaumont Health. They've been using this now with patients, and it's getting rave reviews. And so you might want to consider Prevent, DJ. It might be interesting. You can look up Allura. Prevent is on our website. They have their own website, prvnt.org. You can check that out there too. But this would be something I would strongly consider doing for anybody who's postmenopausal, struggling with recurring infections. This is a really viable option. Again, it's like Allura. It's the same ingredients as Allura, but it's half the price, and it actually has more packs in it. John says, I've been trying for several years to find a blood pressure medication that does not severely irritate my bladder. I've tried all classes and basically given up. My doctors have no idea why lowering my doctors have no idea why lowering my blood pressure increases my pain. Well, so they're assuming that dropping your blood pressure is causing the pain as compared to a chemical irritant in the medication? Why would lowering your blood pressure increase your pain? Hey, like I just sent my medical board another email about another patient who took Jardiance. Jardiance, Jardianc. Jardiance is a type 2 diabetic medication that interestingly, the number one side effect of Jardiance is UTI infection, which is absolutely fascinating. And so this lovely older gentleman, they took him off of another medicine, put him on Jardiance, and about month 2 or 3 started having bladder symptoms. By month 6, they were so severe he had to stop, and he hasn't been the same. And we believe in his case that he does have an unusual, atypical bladder infection from the Jardiance medication. So, John, I'm going to ask. I will. Let me just make a note here. And guys, I really, 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 really need you to say some prayers for Beaumont Health and outside of Detroit. That's our top IC research center, and they are inundated with COVID patients, and it's really bad. It's really, really, really devastating to them right now. And we are saying prayer after prayer after prayer because if the urologists are treating COVID patients, the basic day-to-day operations and the optional procedures are canceled while they're dealing with this crisis. And then they lost their first doctor to COVID. And so any prayers you have for anybody affected with COVID and the doctors that are treating them, including right now our top IC researcher is at risk. So we need every prayer that we can. Heartbreaking. Lauren says ketamine is part of my compounding cream that I use for pelvic floor. Lauren, it's about quantity. It's about quantity. Understand that ketamine is a veterinary anesthetic that is known for causing they call it a dissociative high. You feel like you're floating. And so what happened about 15 years ago or 12 years ago is that when heroin became very expensive on the street, drug addicts started buying ketamine. And in fact, the first ketamine person that I talked with was a Hollywood producer who he's little party group would drive down to Mexico, go to a veterinary supply store, buy ketamine, bring it home, and they just took it at parties. It made them feel good. It has become worldwide a drug problem. And in fact, every urologist in England surveyed by the British Association of Urologic Surgeons were treating ketamine cystitis patients. It has gotten that big. So anyway, here you've got this major Hollywood producer, I won't say who it was, who was using ketamine regularly. And then he started bleeding. He would take it and he would pee blood, and he knew that the ketamine made him pee blood. He knew that the ketamine was damaging him. He couldn't stop. He literally could he and his buddies, they could not stop using it. And they took massive amounts of ketamine and destroyed their urinary tract from their kidneys down. He finally got off the ketamine, going through the Dr. Drew rehab program, actually. Um, but so that's a massive amount of ketamine used daily, whereas you're using a little bit of ketamine in a compounding cream, and that's normally fine. It's just a quantity issue. If you take too much, you run the risk of getting to the concentration that will damage your bladder. Joan says, I was told by my doctor to take or Azo, and if the symptoms are not better in 2 days, that may be an infection and not IC. That is so weird. Um, and if you're eating something you think might cause a flare, like chocolate, take pre-leaf while eating. Well, yeah, yeah. I mean, I would be more tempted to have, again, I don't like guessing. I like facts, but some facts are questionable sometimes. I think it'd be more interesting to have a urinary test strip. So if you're having a really, really severe flare and you just don't know if it's not infection, pee on a strip. And if you have a double positive nitrite, positive leukocyte, then you definitely have infection and you don't have to wait 2 days. And the thing is with the azo, when you're doing the azo and it turns your urine orange, that messes up urine test strips. Now, people would argue that urine test strips are not accurate, and I agree they're not that accurate, but it's a preliminary screen. And if you test positive for leukocytes and positive for nitrites, which are only produced by bacteria, the doctor and go leave a urine sample or have a next gen test to see if they can figure out what it is. Linda says, "What are my thoughts on desert harvest aloe?" Desert harvest aloe vera has been around for 30 years. They were around when I started the IC network in 1993. Aloe is known for being very calming and soothing. We had a really interesting case of a little boy, like a 5-year-old, he was quote unquote diagnosed with IC. Who knows at that, now with subtyping, it'd be really interesting to go back to his case. But again, he was so young, all he could tell his mom, he said, "My pee-pee hurt, my pee-pee hurt." And the only way they could extrapolate that information was to assume that he had urethral pain. So they gave him aloe, an aloe drink, and the aloe actually made it go away. So aloe is known for being very calming and soothing. Aloe Desert Harvest is the only aloe company who has done a double-blind placebo-controlled study showing that aloe was helpful in calming and soothing the bladder. It was a small study, and they need a more rigorous study to make a better claim. The challenge with aloe is that for quite a few people, it can cause gut distress, stomach or bowel distress. So when people are talking to me and they want to know what can I do, question number one is, have you ever taken aloe? And if they say yes, I say, did you have a reaction to it? And if they say yes, then okay, then you can't do the aloe and you can't do the Sister Renew. You've got to look at the other products. It's very individual with aloe. If you're looking for a bladder wall effect combined with the quercetin and stuff like that, Sister Renew has chondroitin and aloe in it. So instead of taking two separate supplements, you can take one that's combined. And Desert Harvest has their own line of other products. They've got um, um, chondroitin and glucosamine with aloe, and a multivitamin without vitamin C, and then they've just got a whole range of, quercetin, of other products that you can take. I think the challenge with aloe, to be quite honest, is it's just expensive. You have to take a lot of it. They suggest taking 6 a day, and it adds up. The costs add up. Cara says, "My bladder doesn't wake up after surgeries. In the beginning, when I started having procedures, I would end up in the ER with retention issues, so they always make me pee." before I leave the hospital, but I never can go, so I end up having the Foley. My hydrodissension was the worst retention problem of all. I think the doctor went too far. I'm sure of it. It really ruined me. Yeah, hydrodissensions are supposed to be done low pressure, short duration to avoid damaging the bladder. If they did a high pressure, long duration, that's that you put a lot more fluid in the bladder and you keep it in there for a longer period of risk of bladder damage and bladder rupture. So the American Urology Association does not recommend high pressure procedures. They just don't. Anytime a hydrodistension is done, and it's done to allow doctors to look more closely at your bladder wall or to treat lesions or to do a biopsy, it is always meant to be low pressure, short duration to minimize bladder wall trauma. Cara, it'd be interesting to know when you had that done because that's what they were doing 10 years ago. They're not supposed to be doing that now. Ruth says, I had a distension. It for sure made my bladder worse. I remember on the ground crying in pain the first time I peed afterwards. So you guys always understand anytime you have a procedure where they're going into your bladder, your urethra is going to become very, 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 very irritated. And the first couple of times you pee afterwards are terrible. I had, when I was a kid, quite a few urethral dilations, and the first couple of times you pee, your urethra, it feels like it's being sliced in two. And that's when you stretch the urethra. It becomes uber, uber sensitive, if not irritated, if not a little bit torn. So that's very routine that you would have painful urination after a hydrodistension or a cystoscopy. Lauren is saying, what about the women who stopped, or the men and women who stopped Elmeron years ago but still have the eye damage? Would they get That's a platinum-based chemo. I don't know, hun. Let's look it up. So platinum, let's see. Ooh. I am so, so sorry that you are going through chemo, hun. It's so hard, so life altering. Um, Again, the Mesna. Hun, Shelley, the Mesna might be the best thing for you combined with something like with chondroitin that might be a bladder coating effect. You'll have to talk to your oncologist about that and see what's appropriate for your case, son. But just know I see patients get through it all the time. Hey, listen, you have never been more prepared to deal with whatever happens to you in your life than you are at this very moment because you are truly one day older and one day wiser. You're going to kick this cancer in the butt. I want you to be fierce. I want you to use a lot of guided relaxation, meditation, visualize your body fighting and defeating that cancer, and visualize your bladder trying to protect itself from that cancer with a nice thick coating. Visualization is very, very important because you're just kind of telling your body and you're telling your mind what to do. Gives you an endpoint. It gives you something, you know, um, it's a different. I'm not saying the visualization will cure cancer in any way, shape, or form, but what I am saying is that when you give your brain a roadmap you tend to follow that roadmap. So anything that you can do to visualize your body fighting and succeeding over that cancer is the way to do it, hon. The way to do it. Kick butt. Judo. Just yeah, you're using your judo to do it in your mind. You guys are so good supporting yourself. Jill, not a single post saying everyone is embedded. Claire, but you know they're out there. You know they're out there. I was just reading a post in IC Today on the IC Today Facebook group that said that, like yesterday. It's happening. People are saying that. Joan says, I never had IC until after my hysterectomy. Could that be the cause or straw that broke the camel's back? Yeah, definitely. Hysterectomy causes a lot of muscle damage. And so, if you already had a history of recurring pelvic traumas, other falls, other incidents, then absolutely the hysterectomy would also have caused significant muscle damage as well as sensitize the nerves. As well as just remember, I had levator antispasms for 10 months after my hysterectomy that were absolutely brutal. Carol says, I just had Hunter's lesions injected Friday. Do you think I should start the Peora? I think that where Peora shines in the research study is with pain. So I think the Peora would be fascinating to do to see if it would help reduce some of your pain with your Hunter's lesions. The IC study that was done, that was submitted to AUA last year, found no side effects. And when I went through all the studies that I could find on the National Library of Medicine, and I think I read at least a dozen, if not 20, looking specifically for side effects. The vast majority of them showed no side effects for PEA. Only one showed gut side effects. And so the Peora is another arsenal, another option in our pain management toolkit or arsenal. And I think it's worth trying. I mean, I've tried it and I like it myself. I take it when I start having a lot of nerve pain and like skin pain and stuff like that. And I'm stunned. I'm stunned at how much better I feel. It's so interesting. Jean says, "Do I sell my products in the United Kingdom? We can ship to the United Kingdom. We don't have somebody in the United Kingdom who redistributes them. Would be great to find one. The same one, we were approached by somebody in Israel who would like to bring them over to Israel too. Um, uh, you know, so we're supposed to be, d let's see, technology sucks. Technology sucks, and, um with our e-commerce store for international orders, we have first class international disabled right now because so many packages get lost, like 50-50. It's like 50-50 chance that if we ship something to you internationally, it's going to get there. And when it doesn't get there and y'all ask for a refund, we give you the refund even though we've lost that money too. And so um we had to stop doing it. I mean, we were losing thousands of dollars a year of products that it was financially unsustainable for us. So I just redid our shipping, and we're going to put first class shipping back in, but we're going to say no refunds or at your own risk because we cannot insure first class international. They're not insurable. If you get it international priority or international express, it's insurable. Nobody loses. We will give you your money back. And when we get the product back, we get our money back. So I tried to reactivate it and it didn't reactivate. So we're making changes. We're making a lot of changes. I'm switching our store over to different software this summer anyway. And maybe that will make it better. Um, it's just kind of the straw that breaks the camel's back. It's just, this technology makes me crazy. Gigi, where can we buy Prevent? You can buy it from the IC network right now. We got our first small shipment. Let me see. We have a new skin that's coming onto the store probably on Monday. So, but right now you should be able, if you go to supplements and go to prevent, it's right there. So it's available right now in our store. We only got a couple dozen bottles, so we're going to be getting more. Angie says she's been praying for Beaumont. Thank you. I sent out a letter to our medical board about this Jardiance patient, and I was so heartwarmed by the response the other doctors sent to Ken Peters at Beaumont for what they are going through. DJ says they gave me ketamine when I have severe flares. I started refusing it, and the acute pain service got really mad at you. Well, again, DJ, it's just about dosage. So if they use a low enough dose, it might help with the pain. But if they go over a certain point, it's going to hurt your bladder, and so you just have to have that discussion about appropriate dosage. Gigi says, "What do I think about UTI test strips over the counter? I think that they're at least an interesting way to screen for possible infection, but they are flawed. But even so, it's a little bit of information. So, almost every IC patient goes through a period, especially in their first year or two, where they think every time they have a flare, they have a UTI, and then they do a urine test strip, and the urine test strip is negative, and the culture itself is negative. And again, now we know about these fungal infections. And the question is a urine test strip test for nitrites and leukocytes? And I don't believe that fungus produces nitrites, only bacteria. What we need is a urine test strip for fungal infections. Ooh, God. Ooh, hold on. What a great idea. I'm going to see if I can find one. But I mean, if you got positive nitrites, positive leukocytes, then to me, that means you call your doctor and you ask for more testing. And again, a urinalysis itself is very flawed. It misses 95% of the potential bacteria that will grow in your urine. A next generation test will identify all the bacteria and fungus in your urine. But as Claire correctly said, the challenge is that we don't necessarily know what's normal and abnormal for the urinary biome. But again, it's at least it's data, it's at least it's information, and we're not guessing so much. And the advantage of a next generation test is that they will for sure identify drug resistance genes. So for those of you interested in it, you can go to bladderhealth.org, and learn more about it. There's a lot of videos over there from doctors using next generation testing. And Microgen is also now testing for COVID, which is wonderful. Kara said she had her hysterectomy in 2016. It was so bad. Oh, you had your hydrodistension in 2016. It was so bad you got girl, absolutely. Sure. I believe that. I had tension in radiology without anesthesia, and I was screaming like a lunatic when they did it, because the radiologist ignored the doctor's instructions and put twice as much fluid in my bladder to do a test. She got fired. I complained. She got fired. She deserved it. She completely ignored my doctor's instructions about what to put in my bladder and how much to put in my bladder, and absolutely PTSD. I walked out of that shattered. Shattered. I was sobbing after that. My mom was in the waiting room. I was 32 years old, sobbing my eyes out after having hydrodistension without anesthesia. Massive PTSD. Joan says, my bladder dropped. Can this cause repeated infections? Only if your bladder's flip-flopped. So remember your bladder is basically a small, maybe the size when without fluid in it, maybe the size of a tangerine, right? And then it expands as it gets fuller and fuller and fuller. So sometimes the bladder flips off like that and you get a pocket. And so if urine is collecting in a pocket, then yeah, you can get recurring infections in that pocket. And it would be interesting if the prevent could help prevent some of those infections until you can get that surgically repaired, because the odds are you're going to have to get that surgically repaired if you've got a big pocket. Cheryl says, is the product Peora usable and effective for nerve pain? And the answer is PEA, palmitoethanolamide, has been studied with many conditions that are around nerve pain, and it is considered the most successful with nerve pain. Now, Peora is just the brand name, and they don't have studies with this brand name yet, but we've got the baseline studies with the ingredients in this, and this is replicating the ingredients in the ICU research study. And so, yes, palmitoethanolamide has been found to be particularly helpful for patients with nerve-driven pain, like sciatica, or in some patients like interstitial cystitis, if you've got nerve pain. Angie says, what causes skin pain? I've been having it. Feels like a sunburn, but just certain places like the back of my left leg. Well, that can be, generally pain is caused by nerves, right? So you could have, in fact, Dr. Weiss in this book, this has a big discussion, two big chapters dedicated to neurologic driven symptoms and neuropathies. And one of the things that he does to test for a neuropathy is he studies the skin. And if the skin has pins and needles, if the skin has numbness, then he's always that is pointing him to a nerve-driven, pudendal neuralgia-driven situation. So, I mean, you could have a deeper nerve compromise that is affecting that patch of skin there, or you might have a skin disorder that gives you that prickling too. It would be good to go see a dermatologist and see if they can help you figure out why you've got pain right there. I get a lot of, because I'm a central sensitization patient, I'm a redhead, I get a lot of pins and needles in various parts of my skin all the time. It could be in my toe, it could be in my shin, it could be in my shoulder, and it's just random. And that's when I take the Peora, and it completely stops it. And I don't take it every day. Like, I haven't taken it in, like, 2 weeks, and I'm not having any of that pain, where normally I have a lot of that central sensitization nerve pain myself. Joan says she was afraid to take estrogen, but you're afraid of the side effects. Well, hon, it would be very good for you to read a little bit about, just Google safety topical estrogen. Topical means it's a topical cream used on your skin. Estrogen cream is considered much safer than oral estrogen because it usually stays in the area where it's meant to be. It doesn't get in the bloodstream to any great extent in comparison to taking oral estrogen, where it's delivered throughout your body via your bloodstream. And that's why oral estrogen makes you more at risk of breast cancer, cervical cancer, uterine cancer, etc. Topical estrogen cream is considered much, much safer. Um, DJ says, comments old is a great platform. I don't know. Would that help me do this? Julia, well says fungal. I've not heard that. Yeah, hon, we've known about the fungal connection for the last 4 or 5 years. Could could be fungal infections, colitis, and vulvodynia. Skin pain is usually nerve pain. Exactly. Isabel says you cannot get that test in New York. That is true. I had somebody from New York this week, and that might have been you, Isabel, asking for it. But if you Google next gen test or DNA test New York, there are companies in New York that do it. Joan says, have you heard of Belitude, a plant-based estrogen? No. Hey, Claire. Claire, I'll make you an offer, hun. If you want to um, outline the key points you think are important for IC patients to know about with chronic infection, uh, why don't you do that and send it to me, and then connect with that doctor in Louisiana, and let's try to do an article on it, okay? I will make you that offer. I know this is so important to you and to so many other people, and I do not want to be disrespectful in any way to what your experience is. I just have to approach this from what I know as a support group leader. And with all the work that I've done with the US Army and IC research. So we're not butting heads. We're like this. Like, I'm willing to go a certain point. I just can't go all the way right now. But if you have a perspective and a point to make, and if you can give me the key points and the key links that you think are important, I promise you, in front of all these people, I promise you that I will read it, look at it, try to do an article on it with my unique spin to it. But it's not going to be, I mean, I can't, I have to do it based upon what I know from my work, but I want to be fair, and I want to be as respectful as I can possibly be, because I do believe that there is a small population of patients who do have chronic bacterial infection. But I also do believe, based upon the MAP Research Network, that there is also a significant population of patients with a fungal infection. But I'm willing to try. I'm willing to try. icnetwork@mac.com is my personal email address. Send me your checklist of every point you think is relevant here, and I will work on it in the next month or two, and I will try to get it out. I promise you, I will try to do that. I want to be fair, and I'm try to be as open-minded as I can. I really try to be that way. So, it's just hard, there's a depth of experience here where I've seen the other side. Ah, it's so hard. And this is, if anything, this proves the diversity in this IC patient population. All right, YouTube. YouTube. Oh, I'm so sorry, YouTube. I am not ignoring you. I promise. You guys, I'm simulcasting live on Facebook and YouTube. So let me go back to YouTube here. And hey, guys, I'm going to start turning on the Twitch stream, because we really need to switch over to Twitch, because then I can show you stuff, and I can show you how I research things, and I can show you the diagrams, and I can show you all that stuff. Kristen says, fungal infection. How would you know if you have a urinary fungal infection with a next generation urine test or an oats test? So, Kristen, it was the National Institutes of Health MAP Research Network here in the United States that first discovered about 5 years ago that many patients having flares have an overgrowth of candida in their urine. Now, the MAP Research Network is the best research team in the world, and it is funded by our own US National Institutes of Health. And it is not one or two people, it is this incredibly diverse and robust team of researchers from around the nation, not just urologists, but it's also gastroenterologists, lots of other people that are trying to look at the totality of what triggers pelvic pain, what triggers IC, what triggers chronic prostatitis. So they're the ones who found candida. And they have done, I think, 3 research studies now, which continue to find fungus in the urine of IC patients. And the last one was a year ago. They released another fungal study. And what made it so important is the diversity of species. So let me just find that real quick. And so the question is, why do we have fungus in our urine? And the answer is probably related to the overuse of antibiotics. So if anybody's overexposed to antibiotics, it's a lower urinary tract patient. Okay, here, hold on a sec. Where is it? Oh, it's not in this issue. It's in. We have so many magazines, 16 years of patient magazines. And if you're a member of the IC network, you get to read the back issues. And if you find these meetings helpful, guys, please support our work, because it's your memberships that keep these meetings and keep us going. Where is it? So here's an article. Here's an article that I did. The great debate is I see the result of infection. We did that article last year. And I went over all the issues that I knew back then. Okay, well, anyway, I think it's in our fall 2019 magazine. And what that study found is that the diversity of species matters. So what they were doing was next generation testing of the urine of IC patients, and they compared our urine with the urine of controls, people who didn't have any UTI or IC symptoms. And what they found is that the greater the diversity of fungus, the more intense the pain. And they identified 13 different species of fungus in the urine of IC patients that they did not find in non-patients, non-IC patients. And so the more types you had, the more severe your pain. You guys are so good at supporting each other. You just impress me every single time. So Zana over on YouTube says, I was genetically tested for chronic bacterial infection. It was negative, but I'm in pain every day. Can you call? Absolutely, Zana. I'm available almost every day of the week. I answer our phone line for the IC network. I am more than happy to talk with any patient at all. You're welcome to give us a phone call. Who is it? Who is it? There. She asked who the top doctors are in the United States. It's going to be Robert Evans at Wake Forest University is the top doctor according to patients. Our patient votes. He did win the 2019 Doctor of the Year award. Although because of COVID, we haven't been able to give any of the awards out, which is too bad. So we're looking at Dr. Robert Evans at Wake Forest in North Carolina, Ken Peters at Beaumont Health in Royal Oak, Michigan, Robert Moldwin at Long Island University. They also have a ton of COVID there. You're those are really those are really the top dog. On the West Coast, you've got Christopher Payne at Vista Urology in San Jose, California. Christopher Payne uses a subtyping system that we use. Kata, you ordered the P Pure from the Netherlands. Excellent. So Kata, the Pura uses actually more of the PEA and the resveratrol than the P Pure. How much was it? I know that the last time I talked with um, a compounding pharmacist down in San Diego who wanted to do it, um, it was very, very expensive, like $1,000 to get it. Texas Red, you would watch on Twitch because I could do Twitch almost every day. I was thinking just having office hours on Twitch an hour a day or every other day. Would that be cool? Like, I'm on Twitch all the I have Twitch on all the time anyway because I'm a huge Twitch fan. Twitch is a streaming service, guys, where you can come into meetings and they have music channels and game channel, all sorts of different channels. The only problem with Twitch is you really have to have a good moderator because people come in and try to be aggro and stupid and insulting and stuff like that. So, kinda like Facebook. Cool, okay. Gigi says, "My dearest friend right now, I'm in an IC group and we talk daily and she's great support." You know what? I gotta tell IC changes you in so many ways when you face something major like this. And for me, it taught me what true friendship was because when it all happened for me, my group of friends were all tennis players because I was a pretty good tennis player, and they all walked away. Not a single, even my best friend from, the, tennis playing friend walked away from me. They were not there for me at all, and the people who were there for me were a couple of my dear childhood friends. But man, the people you meet in the IC community are freaking awesome. I am telling you, I have met the nicest, kindest, sweetest, most wonderful, supportive people. And my life is so much richer because of you guys. And I'm a lot like you guys. Listen, some of us are introverts, some of us are extroverts. I'm an introvert. I'm not one of those people where you can just walk into a big crowd of people and just say, "Hi." I've never been that girl. I can go teach a class. I can talk to 5,000 people about IC and teach a class. I'm fine. You hand me a microphone, give me the slides. I can do that. That is not a problem. You ask me to walk into a room of 20 people I don't know and socialize. Holy hell, is that hard? That is hard. That's hard for me. Some of us are, you know what I mean, right? I mean, some of us are introverts and some of us are extroverts. And when you have IC and you can't leave your house, like I had trouble leaving my house for years. For years. For 5 years, sitting in the car was hard for me. And I really I mean, that's that's what I got used to, was staying at home and not doing those normal socializing, when people your friends wanna go out for dinner and they wanna go to the new Thai restaurant, it's like, yeah, no, I don't think I can do that." Or they wanna go out to a play and go out to dinner first, like, no, no, I don't wanna, if I eat something I'm not gonna eat, I'm gonna have a flare, then I'm gonna have to leave the play early, and then I'm gonna have to get up and use the bathroom. You know what I mean? That's real life when you've got something like this going on. And so we tend to get a bit more isolated. And thank God for the internet. Thank God that we can meet other people and be there for each other and support each other. As long as we're kind and respectful, we're gold. It's the people who are disrespectful and mean and rude that are not welcome. I mean, we are all in this together, and as long as we support each other and encourage each other and respect each other, then we're great. But if anybody comes in and says you're stupid or whatever, like, no, not in this meeting. I'm sorry. But I mean, do you agree? Like some of the people, like one of my dearest, and I wish I were closer to all of you. I wish my dream is to have a bus and to do an IC tour around the country. I'd love to meet everybody, and I love to do a big conference again and have and s- or do an IC cruise, which of course we would never do now. Or you know what I mean. I mean, we just have so many lovely, lovely people. Gigi says, I'm an introvert big time and I'm okay with that. I it was hard growing up as an introvert. I didn't like I have a really good friend, Carolyn, that I played tennis with, and my dearest, I can't we spent hours and hours and hours together when we were in high school, junior high and high school, and on playing on a college tennis teams together. And I always envied that she could walk into a room and just be at home, and everybody's like, "Hi, Carolyn," and she was just the center of the party, and I would walk in and just freak, and then I'd go find a corner and kinda hide. It just wasn't natural. Now I know that I'm an introvert. Okay, I'm more of an extrovert now. I'm better at it now because 'cause I've had almost 60 years to learn it. But man, when you're a kid and you're an introvert, holy hell, is it hard. And they make you feel bad, and it's like, you don't have to feel bad. Not all of us are wired to be trial attorneys or orthopedic surgeons. Some of us are wired differently. Some of us are wired to be writers and artists, and so Julie says, "I tried to call you this past week, going to try again." Yeah, guys, just keep calling. I had one of my staff was out sick last week, and so I was answering literally all of and and I and then I will often spend an hour with somebody on the phone, and so then all of you call while I'm on the phone with somebody else. I'm here every single day right now. We're not going anywhere. So I promise you, I am here. So if you leave a message, no, I will try to call you back. I often call back later. I do work, I usually work from like 10:30 to midnight. 10:30 in the morning to midnight, but I take two breaks in there to fix dinner for my parents and stuff. So, but I work late. I'm a night owl. Joan says, I'm feeling that way now, Jill. My friends haven't picked up the phone or sent a text since I went into a huge flare. I see them text in a group and we'll ask about them. I know, right, Joan? Like, seriously. It's I had another friend, Kathy, that I went to high school with, and again, she was actually with me the day that I got hurt. She was with me that morning. And then we spent company. I went to the pool. I had the chemical burn. And she had the audacity to say to me about 6 months later, she said, "Jill, you need psychological help. You like being in pain." I'm like, "What the hell are you talking about here? I got burned." And I lost her friendship at that moment. I've seen her like twice in 25 years and I miss her, but there was no sympathy at all. If you can't see it, if somebody can't see that your bladder is freaking bleeding, are they gonna believe you? No, they don't get it. Carol says, "You're Carol, thank you, hon. That's very sweetie." Monica says, "What does it mean when I heard after urination? I know it's pelvic floor issue. Does that mean that it's tight or something?" Yeah. Well, okay, so you have to differentiate, and again, I say this to patients all the time. Your ability to talk about your symptoms and exactly where they are is critical to getting a correct diagnosis. So, Monica, you say it hurts after you pee. I need you to tell me where. Where does it hurt? Is it inside of your body or outside of your body? Is it shallow or deep? Is it to the center or to the left or the right of center? So, Monica, where specifically does it hurt? Joan says, I think this COVID pandemic is just a glimpse of what I see is like now, and now add pain and frequency. Yeah, yeah. And you would think that people would be, I think people are under or they're getting a look at life like the life that my parents had during World War II. You know, people are making we have all these protests going on, and how they can't enjoy their lives, or they can't do what they need to do because of this. And seriously, go back 60 freaking years. There were no high school graduations for boys because all the boys were in the war. They went before they graduated, they went into the military. And this is minor compared to what years and years of rationing, food rationing, and gas rationing that wartime brings. And yeah, we are at war with a virus now, and we have to make sacrifices until this virus is controlled. Angie says, I have extremely tight pelvic floor muscles and my bladder pain is mostly after I control. That's one reason why my parents are like so good about this is they lived through World War II. And my dad was already in the service. He went in high school in the Navy. Um, and so to them, this is easy. I mean, you get housebound and you get crazy because you're not doing the things you're doing, but compared to the sacrifices that were made during World War II and Korea and Vietnam, but mostly World War II, you know, we got it good. We got gasoline and we've got food. We just don't have freaking toilet paper. I haven't been able to buy toilet paper in 6 weeks. Kristen says, I'm an introvert as well. Having IC is not easy. I avoid trying to explain it to people what it's like. If I do, then there's always someone that says drink more water, even though I'm telling them it's not an infection. Also have heart failure, so I have to be careful with fluids. Yeah, absolutely. Gigi says, what's flaring me the most? It's what's going on right now. I'm stress eating. Hey, you know what? Anybody else stress eating? Whoa, man. Like, uh, I swear I gained 5 pounds last month and it's coming off now. But it's so interesting the way we get comfort, right? And for me, it's a cinnamon roll. I had a cinnamon roll last night for dessert. As a matter of fact, it's when you start eating 2 or 3 cinnamon rolls that's the problem. What are you stress eating? What's your favorite stress food? I'm eating now I'm just trying to eat like almond bars and some trail mix. Where can I get the products you've been talking about, Joan? They're right on our website, icnetwork.org. Just go to the store. Angie, thank you for sending 50 stars. For you guys on Facebook, you can send us stars, and I think we got $2 our last meeting. And honestly, I thought the meeting I did last week was a really kick-ass good meeting. Thank you, Sherry. Joan says, "What supplement do I recommend to build the bladder?" Anything with chondroitin. The most important ingredient in my book is chondroitin, and so if you've got estrogen atrophy, and we're trying to give you an extra protective coating, in my opinion, the top supplement is Bladder Builder. I would put Bladder Rest second. I would put Cystro Protect third. I would put Desert Harvest Aloe fourth, and I would put Sister Renew fifth. But they're all rotatable, and it depends upon what your sensitivities are anyway. So, but I think that Bladder Builder is the top supplement. A new supplement, they're coming out with one more supplement called Allopath, which is going to be an aloe supplement, but a very, very different aloe supplement. And they've already got patients using it. And Natural Approach Nutrition says that's going to be the kick-ass supplement. Um, I think we're supposed to have it in 2 weeks. Kristen loves cinnamon rolls. Gigi, bread big time and raw ramen noodles. Ooh. Julie says, "Oh my gosh, I can send you some." Yum. Gigi says, "And I don't do physically well." I don't either. I get very bloated and gassy if I eat white bread. I don't, but honestly, there's a cinnamon roll is just wonderful. Tammy says, "Has anybody tried medical marijuana for IC pain?" Tammy, absolutely. And in fact, the IC Network has the longest running medical marijuana research study for IC. We have been running that study now for 7 years. And let me go look at it. And I will tell you that medical marijuana has been remarkably helpful for patients, for some, but not all patients. Let me log in and see. Oh, you know what? See, I deleted my cache and all my passwords. Oh, wait a second. Is that going to work? Oh, good. There it is. That's why. Okay. Hold on. It's sending me a verification code. That's why I was slow logging in this morning because let's see. Let me just go. Oh, hold on. Oh, I see the problem. I got to do it with my other. Hold on. I can only have 2 computers on SurveyMonkey. So let's see what the medical marijuana study says now. So we started talking about it, I don't know, 10 years ago, 15 years ago. So let's see what the latest statistics are. I can also give you, okay, hold on. All right. Be nice, SurveyMonkey. Let me in and look at my research. We have 1,809 responses for our Elmoron survey. We have 34 research studies here. Hold on a sec. Let me find it. All right. Here it is. So 700 patients completed the study. So out of 700 patients, 78% were using medical marijuana to help improve their symptoms. And so the question is, 64% said it improved their symptoms by 50%. 13% said it improved their symptoms by 25%. 17% said it made their symptoms go away completely, and 6% said it did not help. 1.6% of patients said it flared them. So, did medical marijuana reduce frequency? 17% said completely, 39% said 50%, 24% said it improved their frequency by 25%. Did it improve urgency? 21% said their urgency went away completely. 35% said their urgency improved by 50%. Did it reduce pain? 32% said it made their pain go away completely, and 50% said their pain was reduced by 50%. Did it reduce muscle tension? 28% said it completely reduced their muscle tension. 43% said their muscle tension improved 50% using medical marijuana. And then did it improve nighttime sleep quality? 38% said yes, they were able to sleep through the night without getting up to use the restroom. And 40% said they were sleeping normally and only getting up once or twice. And then we asked patients what else it was helping: anxiety, uh, general relaxation, pelvic muscle spasms, depression, mood. Uh, One person says they turned to medical marijuana because medications gave them headaches. Fibromyalgia helped with fibromyalgia, helped improve inflammation, brain fog, costochondritis, PTSD. Somebody who had severe PTSD, it helped them sleep at night. So medical marijuana, at least we did 2 different studies with medical marijuana. We did this study for years. It took a long time to develop the data, and it was, I mean, it shows, at least with 700 patients, that medical marijuana helped them. Gigi very correctly says bread doesn't help for those of us with fungal issues. So true. I don't eat candy, unless I'm really under stress. I might eat Jelly Bellies. It's really rare that I ever eat candy. I try not to bring candy into the house, and I try not to snack on bread too much. I snack on almonds and, stuff like that. Tammy says she's done with her narcotics. Narcotics have a place, in small quantities, but using narcotics every day is definitely difficult. But there are some patients with severe IC who might need that severe pain. Julie says, I myself feel like edibles or vape cartridges help, but I feel like smoking the flower hurts. Interesting. Edibles are definitely preferred. The vape, you got to remember, guys, that anytime you smoke, or you vape, the byproducts of the heat reaction do end up in your urine, and they will damage your bladder, especially if you've got estrogen atrophy. You really don't want to be smoking or vaping anything. Edibles are definitely better. I don't have any data on strains. I don't. I didn't know enough back then to ask about that. And this was THC CBD. This was a straight medical marijuana. Hey, look at this. We got somebody famous in the room. Ileana Brockman. Ileana is Ileana and I are old timers. I both got started working with IC patients back in the 90s. And is Ileana is the perfect example of a patient who is determined to be part of the movement to help people. And she is the one who started this company called IC Relief that makes glass wands for internal pelvic floor work. And this is an example of one of the wands that her company sells. We actually buy them from her and sell them through the IC network. And Ileana, it was so. I remember when you started your company, right? And this was really right about the time that we were starting to figure out the pelvic floor, but it was a really, inspired move that was actually I found a little bit confusing because I didn't quite understand the importance of internal pelvic floor work like I do now, and we all owe you a tremendous gratitude for doing this and doing this a nice easy way. So guys, if you have to have if you've got chronic pelvic floor tension and you've got internal trigger points and you feel your muscles getting tight, your physical therapist will normally teach you how to use something like this, or et cetera, et cetera. And so she has three sizes of this. She's got a straight wand, she's got this curved wand, and then a larger curved wand, which is a little bit easier to use. And they come with samples of desert harvest aloe gel to use. And so these are really cool. And she's got really, really good relationships with many of the best physical therapists in the nation working with pelvic floor. Angie says, "Thank you so much. I love my wand." Oh, gee, hey, Ileana, Gigi says, "What should we use to clean our wands?" If you want to answer that, that'd be great. I use hot soap and water myself. Tammy says, I had Percocet or morphine, just one every day, but such bad constipation. Good to hear about the fungal issues." Ileana says, "Dr. Rob Moldwin was the person that educated her about pelvic floor dysfunction." Very cool. Is it abnormal to have a low fever during a flare? It's pretty abnormal, yeah. I mean, it has been talked about kind of vaguely over the years, but nothing consistently. Lauren says, "Car rides are one of my biggest triggers for a flare. Your pillows have helped, but it's still awful." You got to look at the car you've got, hun. If you've got a car with a stiff suspension where you feel every bump, that's why it hurts so bad. Like a lot of the Japanese cars have very hard seats, dental neuralgia, pelvic floor dysfunction. That I was driving a Buick SUV for 10 years, and that was my dream car. I could drive anywhere in my Buick SUV. And it finally died after 10 years. And I ended up buying a Nissan, which is so much worse. Um, and I can't wait to go back to a Buick with a really, really smooth. Time vaginal suppositories calm down a skin condition, or is it taking away the inflammation from the urethra? Gentima. I've never heard one. Got any suggestions for somebody? No, 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 no. You'd love to see the ingredient. Oh, here it is. Hold on. What are the ingredients of Gentima? See, this is something that Dr. Jen got. Glycerin, almond oil, olive oil, lanolin, uh, Boruhavia diffusa extract, propanediol, sorbitan, castor oil, polysorbate 20, phenoxyethanol, more alcohol, ethyl hexyl glycerin, tocopherol acid, seriflava, carbomer, diethyl methoxychromonyl. All right. So here's what literally one of the cleanest areas in the human body. Why? Because it sloughs off cells every 4 hours. The top layer of cells in the vagina is sloughed off every 4 hours because sex and the introduction of bacteria and stuff during sex. So the vagina is self-cleaning and the vulva is self-cleaning. And you using anything harsh there, when I read off those ingredients, I would not want those ingredients on my whats, my tender bits. Is because it's got oil in it, which means plain coconut oil or V Magic. So a vulvar care cream, and it's made with extra virgin olive oil, avocado oil, beeswax, and sea buckthorn oil. And I use this, and I use coconut oil too if I'm feeling dry down there. But there's no alcohol in it, and the flaw with that cata is the alcohol. urethral pain, the fact that you're having urethral pain also points to estrogen atrophy as a possible condition. I would encourage you to go to your gynecologist and have them look at your skin. Because if your vulva is dry and your vagina is dry, so is your urethra and so is your bladder. And the urethra is kind of like the first part of the urinary tract to really start screaming when you estrogen levels drop to a certain point. And so if you feel like you've got a drop of what they would do for that is have you rub a pea-sized drop of estrogen cream directly into directly at the entrance to your urethra. And that's what I do, and it works so well because it helps your skin produce mucus. Now, Ileana said about how to clean. You can clean it with anything from soap and water to alcohol. Unlike other wands that are acrylic, medical glass wands are not porous. And then she said I should check out the new Easy to Cool ice pack and pad. Cool, I will. Tammy says, does anybody else have chronic soreness in the perineum area and broken skin down there? If so, what do you use on it? My husband finally installed a bidet. So again, Tammy, that's the same thing. Your skin is meant to be moist because it's a mucous membrane. And so if your skin is dry and flaky, then just like dry mouth, you know how painful dry mouth is. Well, dry vulva is that painful. And so using something like coconut oil or V Magic, or if you've got estrogen atrophy, using an estrogen cream, a compounded preservative free estrogen cream is what you would do. Also making sure that you're not using a harsh soap down there. You can use a perineal bottle, but you've got your bidet, which is great. Um, but ultimately, the skin is meant to be moist, and using coconut oil or V Magic is the way to go. John Lee says, since using magnesium before bedtime, my pain and frequency has almost disappeared. What is it about magnesium? Well, magnesium helps reduce muscle tension and muscle spasms. If I remember correctly, and I'm pretty sure I remember that magnesium for people who have chronic muscle tension and cramping, they usually suggest that you take magnesium and that would be my guess, John, would be that it would be the magnesium. Kristen says when she had pain years ago, she had low grade fevers all the time. Interesting. I totally believe you. And it would be fascinating again to do a next generation test to see if there's anything interesting in there. Gigi is replying to Ileana, what about acrylic ones? I don't like the acrylic wands because they can leave pieces of acrylic in you, microscopic pieces. I think the glass wands are much safer. Lauren says, have you known anybody who's developed IC because of a trauma to the bladder? Oh, hell yeah. Thousands. From uh, surgical trauma, hysterectomy that's punctured the bladder wall, to physical injuries, to uh, uh, really, really, really sad cases of sexual abuse to children. I won't even say what that was. It's absolutely awful. Lauren, I don't understand your question. How do I find a professional who will agree to that? I don't know what that is referring to. You can find the glass wands in the IC Network store. Just go to icnetwork.com. Lauren says, does anybody else have ulcers in their urethra? You know, hun, that's really interesting and that's pretty rare. Um, how do you know you have ulcers in your urethra? Did they find them when they were doing looking at it through a cystoscope? All right. So how long have we? Oh man, we've been doing this for 3 hours and 20 minutes. I think I have hit my peak. So last call for questions. Last call for questions. I need to get out into my garden and go water my veggies. You had 8 ulcers in your urethra? Wow. I mean, that really poses I think that one of the first things I would wanna know is there any chance that they are HPV driven? Human papillomavirus? Is there any chance they're HPV driven? John Lee says, and I'm sorry, hon, I know you're a girl. I know. Compounded estrogen irritates me. What do I do? Well, most compounding pharmacies will switch the base and they will try different bases with you until they find a base that will work for you. And so, like the Women's International Pharmacy, they have a propylene glycol free cream, which is the one I get. But if you react to that, they can actually put it in an oil, and the oil would bypass all the chemical irritants. Oh, Lauren wants to know how to get a doctor to agree or verify that trauma caused your IC. Well, it depends upon what the trauma was, hon. I mean, if the trauma was a result of a medical procedure, then it should be in the surgical notes, right? If the IC happened after falling on her bicycle and hurting there, if she didn't go to the doctor right away, that's gonna be harder, potentially harder to get a doctor to verify. Um, Hopefully, it's in that medical history, in the medical files. Jess says, "What can I do for sharp stabbing pain in my vagina? Could it be your urethra, or your bladder?" So Jess, is the stabbing pain inside your vagina or on the outside of your vagina on your vulva? Okay, guys, remember you can order the wand through the IC network and support this chat. And if I'm out, go buy it from Liliana's website. But if I still have it, please buy it from us, okay? Okay, so Jess has sharp stabbing pain in my vagina. Could that be your urethra or your bladder? Urethra pain is a very sharp and low. When you've got urethral pain, you know it because it feels like something very hot is coming out of your urethra or like a razor blade, and it makes you jump. It makes you jump. Urethra pain is like, "What the hell with that?" Urethral pain is like, "Oh my god, no." And it tends to be very quick. It doesn't usually throb. At least my experience with urethral pain is that it's sharp for a couple of seconds and then it goes away, and then it's sharp for a couple of seconds and goes away. Nerve pain, if she has pain, if you have pain when you're sitting down and it goes away when you stand up, that means that you have a nerve that is being squeezed by your pelvic floor muscles, and you could feel that pudendal neuropathy almost anywhere. For a guy, they feel it at the tip of their penis. For women, you can feel it on your vulva. It can be like pins and needles. You can feel it with a persistent genital arousal disorder where it's accompanied by kind of this weird painful arousal sensation. So if sitting makes it worse and standing makes it go away, we would be looking probably at a pudendal neuralgia. But it's also important that you get checked to make sure that there's nothing else going on in your vagina. And they've looked at your vagina and looked to see if everything is healthy, right? And if you're of a certain age and you're menopausal, either perimenopausal or postmenopausal, your sharp pain in your vagina could be dryness from estrogen atrophy. So I think your first step has to be to the OBGYN and let them do an examination. Look at the quality and health of your skin. Are you suffering from estrogen atrophy? are your muscles tight? And that would help you rule out and exclude some of the other symptoms. Kristen says she has pain from sitting too long as well as standing. See, now I've been sitting here for 3.5 hours and my nerve just started vibrating. Like literally, as I was saying that, I now feel the vibration sensation in my left butt cheek going down the back of my thigh about a foot. And that means I've been sitting too long and that's pressing on that nerve. So all right, guys, listen, if you need, you're always welcome to give us a phone call. The IC Network is the only patient organization that takes patient phone calls all day, every day. There's often a queue. First come, first serve. If you call our 800 number and nobody answers, that usually means we're already working with somebody else. So we will please leave your name and number and we will call you back as quickly as we can. Sometimes it's within a half an hour and sometimes it's within 24 hours. We definitely get a lot of phone calls after doing these meetings. Be prepared for the fact that I often call back later at night after dinner. So, because I work in California. So, if you're on the East Coast, I am still making phone calls at 5 o'clock my time, which would be 8 o'clock your time. All right. So 1 800 928 7496, 1 800 928 7496 is at the top of our website and it is also on our Facebook page. I promise I'm going to do a support group meeting this week and I will have a giveaway then. Grace says, before you go, what kind of urethral pain can estrogen atrophy cause? Yeah, shooting pain. Shooting pain is a yes. It can be shooting pain. It can be feeling like there's a drop of urine. Um, it can be burning. It can be uncomfortable. Lauren says, can I hold this up for the next generation? Right here, bladderhealth.org. Bladderhealth.org. And understand that the vast majority of local doctors do not use this. They don't know about this, or their health insurance won't pay for it, so they poo-poo it. It's really at that national level and at the research level that we see next generation testing be done. So don't be surprised if they don't know about it. It's okay if they don't know about it. Your answer always needs to be, hey, listen, your testing isn't finding anything, but I'm not doing well on your treatments. I'm getting worse rather than better. I would like to do a more aggressive test to see if I have by chance a fungal infection. And the next generation test would do that. All right. Your homework, 15 minutes a day. I need you to do something for your spirit, something that makes you feel good. I will be going out into my garden. 15 minutes a day. I need you to do something for your noggin. I need you to do something to improve your knowledge about IC. Go to our website, go to the ICA website, go to the National Library of Medicine. And lastly, for 15 minutes a day, I really, really need you to do something that's super fun and makes you laugh. Because when you laugh, your brain modulates your pain and decreases your pain. If you're crying and you're in pain, your brain will intensify the brain that is in the midbrain. If you are laughing and you're in pain, your brain will minimize that pain. And that is important. So bring a little bit of laughter into your day. For me, I've been trying TikTok dances. Okay, I can do this one. Right? Oh, wait, hold on. Okay, do. And then, you could do your lips. Do. Wait, do. I'm trying some of the TikTok dances. I would love to learn them. I think they're hysterical. Debbie says, can bladder problems, oh, and I can do this. I can do this one. Wait, hold on. This one. Wait. This one. Pokemons. I'm trying to do Pokemon's hand things. Okay, Debbie, can bladder problems give you gas? No. No, if you've got gas, the only way a bladder problem could give you gas is if you're eating a lot of gas producing